Okay, good afternoon, everyone. My name's Glenn McGregor from Durham University. I'm actually a climatologist, and I've been working in the area of climate and health for some time, and I have a particular interest in heat and health, as well as cold and health. I have to be honest with you. The theme of this afternoon's presentation is slightly outside my comfort zone, partnerships and capacity. I'm a typical academic. I think about these things, but don't work on the ground doing a lot of this. But anyway, I think it's undeniable the importance of partnerships and capacity building for the success of any system or any problem we're trying to manage. And I think we've realised over the last 10, 15 years that no single agency or no single academic discipline can have all the solutions or answers to a particular problem. And that's because many of the problems we are trying to manage or understand are in fact wicked problems or complex problems. And of course, to understand complex systems, we need input from a whole range of agencies, academic partners, private sector, so on and so forth. So what we're hoping to achieve with this session, what we're hoping to achieve with this session is an understanding of what are some of the processes that lead to developing good partnerships and building capacity. Now, I've got a couple of kind of working assumptions here. There's an assumption in climate risk management systems is the availability of capacity at a variety of scales from the individual through to the whole of institutions. So we often assume that we have the capacity or would like to have the capacity to make our management system work. And it's also often assumed that institutional integration can enhance that capacity through integrated planning, preparedness, response, and recovery activities. So given that, what we hope to explore in this session is this notion of institutional capacity building through partnerships. So we're going to explore that in this session in order to identify some of the opportunities, constraints, and barriers to working together, because that's essentially what it's all about, is working together. You know, partnership building is essentially like a marriage. How do you maintain a marriage? You find your partner first before you even think about getting married. Once you get married, how do you maintain that good working relationship in that marriage? Next slide. Yeah. So these are some of the broad, let's call them framing questions for the session. How to ensure we're answering the right questions, the user needs it, driving the information and solutions. What institutions need to take action, so that identifies in many ways some of the partners that need to come together to change business models. So I think the future is all about not business as usual, but a cultural change in how we approach problems and find solutions. So these are some of the broad framing questions. Now, I'm very conscious of time. Our first two speakers need to get away as soon as possible. So we've got a good program here. We're breaking for coffee. After coffee, we'll have two more presentations, and then we'll go to a small breakout session where we'll get down and talk about some of the learnings around partnership. So it's my pleasure to introduce Dr. Donald Lee, who's going to speak to us about opportunities for global impact working with family doctors. Dr. Lee is president of WONCA, which is the worldwide network of family doctors. So over to you. Thank you. Put on this slide.
Yeah.
I think it's a small enough room that we don't need a microphone.
and I freeze my hand to look at this. But anyway, it's great, thank you for the opportunity to talk about roles of family doctors. We do feel that there is an important role in heat and health and in environmental issues. But first of all, some of you may not be familiar what is WOMCA, or the World Organization of Family Doctors. But actually, we have membership of over 500,000 family doctors around the globe, with 150 national colleges and academics represented. So all those who really think that family medicine should be general practitioners trained with certain standards are involved with us. And we have working parties and special interest groups and research which includes a whole range of issues pertinent to primary care. This is our website for those of you interested to know more about us. We actually have these working parties that work between World Council meetings. So everything's going on throughout the year with specific areas of interest. And there are hundreds of family doctors who work by correspondence and intermittent face-to-face meetings. And over the years, they've actually carried out groundbreaking studies and research and have produced a variety of important publications. Before we proceed, why, family doctors, let's just rethink about health. Something from the Lancet 2010 on health professionals. As I said actually yesterday, health is about people. It's people who need care and also providers who have the quality. And then family doctors are at the front line providing this. But we want to make sure that they actually have the competence and also the commitment ethically and also social accountability. So again, heat, health, environment is part of what family doctors should be engaged in. So why should family doctors care about planetary health? We are at the front line of protecting health. We need to understand the relationship between environment change and emerging health risks. And also, we are trusted. It's the relation, family medicine is about a relation, doctor-patient relation, and there's trust. So whatever we can communicate as far as environmental issues, temperature issues, people tend to trust what we say. So I think we have a very important role there. And we have actually a working party on environment. The mission is to foster the role of family doctors in protecting the health of their patients and communities from the impacts of environmental hazards and environmental degradation, and to promote healthy and sustainable society. And this, of course, includes temperature-related issues. Yesterday, Emily, talked about the extreme temperature. So from a medical point of view, we need to be well versed, and we do know a few things, infectious diseases. In fact, now even in non-tropical areas, for example, we're getting malaria, and also increased temperature can create conditions particularly suitable for the spread of things like malaria. So this is knowledge, from the front line level. And likewise, NCDs, we actually deal with a lot of these family doctors. So again, we need to know how environmental variables such as air, water, land pollution, climate change can make changes in our food systems, for example, that can affect the management of NCD. And then warmer temperatures can increase the formation of this tropospheric ozone, smog, which of course for cardiorespiratory disease and all that. So we need to be aware of this. This is knowledge from the family doctor's point of view. And then, of course, we are conscious of the impact of global warming, the risks that is happening, especially in this area, even in Hong Kong, in Japan, and all that. So, again, the social accountability, the understanding of the family, not just seeing patients. Capacity building, we totally adopt, and we think that, family doctors should be included. When we talk about capacity, it's physical, institutional, social, or economic. And there's leadership and management. I think family doctors can be involved in this. And we totally agree the approaches of risk mitigation and adaptation, and then also the recognition of disaster risk reduction and climate change adaptation are essential components of community resilience. So again, our participation and our appreciation for these facts. The role of families in disaster, this, I have a special interest in this because I really think that as frontline doctors, we have a responsibility. First of all, in risk assessment, we understand what risks are at present, for emergencies and all that. And then the preparedness, such as vaccination is a kind of preparedness, right? And then the risk communication part, how family doctors get involved. But also action and response, alerting. We are at the front line, as I was saying yesterday, patient comes in for a minor ailment, but you can alert them. Are you aware of temperature changes? Are you aware of the risk associated? But most important, in bad, emergencies or disasters, we need to maintain our regular services. People still are ill, they need maintenance. So that's a very important role of family doctors. And then, of course, during recovery and rehabilitation, post-traumatic stress disorders, reducing also exacerbation of chronic disease. So we have a role. So in capacity building for disaster risk, reduction and resistance, maybe we should, this is the classic cycle of preparation, response, recovery, mitigation. We should integrate climate change in the cycle to make people aware. Yesterday it was mentioned the Lancet countdown. We were quite aware of that, and again, we want to make sure our family doctors know about this. There were 41 indicators tracked across 5 domains, and there were actually quite a few messages. So again, this is really awareness. I won't go into the details of this, but again, this is continuous medical education, professional development. Family doctors need to be, up to date with what is going on with the environment as well. And we are actually a member of the Planetary Health Alliance, and we issue statements, to our family doctors, again, to alert them of current changes. We see the key opportunities actually to intervene is communication, obviously, most important about what is happening, and to be aware and monitor local environmental factors such as heat waves and other natural disasters, land clearing, air quality, which may affect the patient's health. And also we can actually participate, assess and plan for threats within our own practices, and we should encourage local communities to have their local disaster plans. I think this has been emphasized in disaster risk reduction and all that. But also just information, taking opportunity of the chance to see our patient, food choices, active transport, energy choices, reproductive health, connecting to nature, reducing personal and environmental impact, engaging in community. All these are behavioral changes that are very important, and we are in a position to change our patients. And influence in policy, health arguments is actually a very powerful incentive and driver, especially for our politicians and administrators. And we should use this, how to influence them to change policies. Health arguments are not really used enough to unleash action, and many potential advocates, specifically health actors, have not been mobilized due to the lack of knowledge and tools. So we are there to actually upgrade the knowledge and all that, so that they will not become disconnected with the healthcare system. And then, of course, sectoral decision-making silos inhibit the cooperation necessary to ensure that relevant specialists from a range of sectors are fully engaged in addressing issues of mutual relevance. So, we are all here. That's why this is important, this kind of forum, that multi-sectorial, many different stakeholders. Now, partnership. We are actually, we're family medicine, but we have close association with, for example, other primary health care teams, nurses, international health. We feel that they have a role actually in primary health care. Medical students, youth, we emphasize them. They are our future. So we should actually influence, especially on this topic of heat and health. We should introduce it into the medical curriculum and all that from the student level. World Medical Association obviously embraces all specialties, all doctors. Public Health Association, World Federation, and then International Society of Doctors for the Environment, Global Coalition of Circulatory Health, academic organizations, for example, University of Toronto, And also, last but not least, we have a Disaster and Preparedness Response Institute. I think some of you may know in Hong Kong, which I actually chair, and we do a lot of work in actually disaster preparedness response. And this is something that was set up in 2014. We develop training courses, generate knowledge, and facilitate capacity building on disaster preparedness for different sectors of Hong Kong. And actually, even beyond, we will also do a lot of work in China. We are in collaboration with 2 universities in Hong Kong and also Harvard and other academic institutes. World Medical Association issued a statement which we truly adopt. The president said, by talking about the suffering our patients endure and could continue to endure, we are adding a human dimension to the already dear economic predictions of climate models. Again, that's why we're here today. Health is something that may be a bit neglected when we think about just the temperature changes and all that. And he encouraged this discussion at global policy level and talking to politicians, which we agree. So that's all for my presentation. So I'm happy to discuss and answer any questions you have.
Any questions for Dr. Lee? Virginia.
Donald, that was a lovely presentation, and the achievements you got with the Wonka group has been absolutely fantastic. And I know that WHO are really grateful to your support, and you've been talking to Jonathan Abrams. How do we help you in your wish to get heat health information out to your various networks in a way that's going to be easy to do? How do we build on those partnerships? Do we provide you with an e-learning package? What would be the best way that Jin can help you?
E-learning, and actually I would be suggesting that our working group on the environment should join Jin, actually,
Yes,
as part of the tender. And then definitely, I mean, they're a very enthusiastic group, and through them, they should have regular communication. You'll get your information. I'll be writing something about this, meeting to let them know what is going on, and then probably we have some meeting notes and whatever, definitely. And that will be the beginning. And let's get them connected, with you, and then continue. And so that we can feature this actually in our future. We have, conferences every year.
Yeah.
We have annual, world conferences every other year. So we just had one in Korea, a very big one attended by 6,000 people. But we have regional ones actually all over the world, and we'll be happy to engage, wherever you feel appropriate. Next year we have one in Kyoto, and we also one in the Middle East. And then 2020 will be the other world one. That will be in Abu Dhabi. And then so again, we'll be happy. We'll be happy to feature. Yeah, exactly. So make this one of our plenaries, and feature, because we do adopt to this. And we are meeting in Europe in 2020 as well, in Berlin. There are many opportunities, but let's get connected. Let's join each other, and then we will, have more communication.
I think this would be amazing. If I can just finish off before I shut up. I think to have this partnership would be incredible. But if you could go back a couple of slides, through you, I wondered if one more back. Sorry. If we just go back one more. Because it's actually linking to all these other associations that we need your help with. And you are very much involved in all of this. And I think heat waves, I've just been told that in India, they don't have heat wave as a disaster because it's not on the legislation. And I find that totally terrifying. So we really need all the health professionals to say heat waves kill. So we really would love your help in trying to deliver that better.
We can. I mean, we have a South Asia region, Wonka, which includes India, and they've been actually lobbying for a lot of legislation with health related. So again.
So can we join up with you?
Yes, of
It would
course.
be so exciting, Donald, if we could do this.
It strikes me Wonka is a very good conduit.
Yeah.
Ultimately.
Sorry.
Oh, actually, I think he kind of adds would you enable us to actually have political effect? So that's the answer.
Yeah, the organization involves only the modern medical practitioners, or does it also involve the traditional medicine and alternative medical practice?
I wouldn't say so, but rural practice is actually very strong. One has a very strong rural practice because precisely those are areas that may not have the privilege, of advanced medicine and or even training and all that. So we're doing a lot of work to upskilling and upgrading, rural practitioners. But as far as I don't know what you mean by traditional, but for example, Chinese traditional medicine, that's not. I mean, this is still Western medicine, family medicine based. So alternative medicine, other kinds of medicine is not, part of our remit, with traditional. But as far as looking at it from a different angle, whether we just include advanced countries or countries that have already established family medicine, definitely no. In fact, our mission is to help people get to the right kind of level eventually, and actually those privileged countries to help those who are maybe less privileged, and to share our expertise and assist in training as such. A good example is China. I've done a lot of work there, and then we're doing upskilling the rural practitioners. But we're doing, likewise South Asia, India, and all that. Yeah.
I mean, to me, you're opening up the door. Sorry, Ben, this is just so exciting, and I know Donald's got to go. So should we be trying to bid for a small research project to see how we do this with you? Because I think a really close partnership using your incredible rural networks and city networks would be critical to something that is not an expensive adaptation for the communities. It's just trying to make them safer. Would be just amazing.
I would agree wholeheartedly. Donald, that's fantastic. Thank you very much. That was a great start to a very important session this afternoon. We're for the next presentation. Yeah, so the next presenter is Tonoichi from the Japan Ecological Business Support Center in Japan. Chico's going to talk to us about the Japanese heat health warning system. Thank you.
Thank you for your introduction, and it's very happy to have an opportunity to make my presentation. My presentation is different from Dr. Naruto. It is one example of a heat warning system all over the world. Maybe Japan, it is, at first I'd like to mention about the history of the heat health warning system in Japan. The difference between other countries is this system is developed by the Ministry of Environment. Maybe most of the information system was developed by meteorological agencies, but in Japanese case, the positive started from the Ministry of Environment. And before that, maybe the Ministry of Environment system started in 2006, but before the year 2005, we started a guideline for how to prevent heat strokes in Japan. And this guideline was developed acute medical doctors and sport field people and laborers and also medical field, such kind of people developed the manual at first. And then next year we started the information system from 2006 with National Institute of Environment and Environmental Agency. And before that, in Japan, the Japan Sports Association developed the guideline for sport activities with using WBGT. So our system is started using a WBGT from the beginning. And then 2008, the heat stroke patient information started. The Fire and Disaster Management Agency, they managing the ambulance system, and they had an online system to collect patient's information to the center. So they issued the number of heat stroke patients ambulance to the hospitals every on Tuesday. So they started such information system in 2008. And finally, the Japan Meteorological Agency started a heat warning system from 2011. So there is a two system in Japan. So the heat stroke system is developed by the Ministry of Environment is using WBGT, and the JMA issued a heat warning using temperature. The temperature, maximum temperature would be exceeded to 35. They issue the warning for heat wave. So, and then now the agency's liaison conference for heat stroke is held in each May and October. The member is Ministry of Environment, JMA, and Fire and Disaster Management Agency, and Ministry of Education, and Ministry of Health and Labor and Welfare. And that's all. And it is next slide. I'd like to introduce about our observation network. So maybe every country using a temperature or such kind of indexes, but in Japanese case, we use WBGT. So to make WBGT, we set on the globe temperature at the field of JMA. So we installed now 11 globe temperature in Japan, and JMA have 150 observatories, and additionally 840 AWS systems. So we observed the globe temperature at 11 sites, and we had a equation how to estimate global temperature, ground temperature, standard deviation, and wind speed. So using such kind of equation, we calculated the WBGT at 840 stations all over Japan. So we calculate such kind of information, observation information, and also using the JMA forecast, we providing a 3 days forecast for WBGT, and open on the Ministry of Environment website. So the website is consisted from like this. So it is a distribution map of WBGT, and WBGT is colored and categorized in 5 scales, from red to blue. And observation data is hourly updated at the site, and 3-hourly forecast for today, tomorrow, and the day after tomorrow will be updated every 1 hour using observation data. And if you click the map, you can close up the province and the area, and if you click some stations, you can see the historical WBGT and the forecasting of 3 days of WBGT. And before I like to, at first I'd like to explain about the criteria. In Japanese heat health warning system, we're using a WBGT. So WBGT is using for the guideline how to prevent heat stroke at first in sports fields. In sports fields, they're using the WBGT in like this. The threshold is 30, 31 and 28 and 24 and here 21. So for example, the WBGT is higher than 31 degrees Celsius. Maybe in sport fields, sport activities should be stopped, except where organized administrative situation or all activities should be stopped. And especially in junior schools, the sports activity is prohibited at now. And also in Japan, maybe Japan Biometeorological Society issued criteria for the general public. So general public, 31 degree or more hotter situation, aged people should move to cooling room and avoid outside activities. Such kind of guideline is developed by these two associations and well known to the public. So every information is categorized using this criteria, and color is the same, red and orange and yellow and green and blue. So The information is opened on the website, and maybe that this system also has two functions. One is a mail information system. If you want to, if you subscribe your preferable 5 cities and the threshold, you can, the system automatically send the information data. If you put WBGT 31, the observed WBGT was exceeded to 31, the system started to send the information. And so also if you want to, I think that everybody doesn't want to receive in nighttime. So you can set which time your service start and which time you will be like this. And additionally, they have the system has another information service called FTP service. All information is stored in CSV file. So if you subscribe to this system, the system automatically sends a CSV file for 840 stations data to automatically to some disseminated servers. So maybe TV companies or network provider, for example, Yahoo, they are using such kind of CSV files and to make they by themselves develop their website. So the Ministry of Environment just preparing such kind of data set. So the information system is developed by private company itself. It is a system of Japanese case. And this one is. And finally, now I'd like to explain, introduce you about ambulance systems. So on Tuesday, Fire and Disaster Agency issued the number of patient ambulance to hospitals in each day and their symptoms. So death and severe symptom, moderate and very light symptom like this. So putting such kind of number, and the number is a casualty up to date. So putting such kind of patient number and WBGT, you can easily understand that when high temperature event, the ambulance people is increased, and also there were 10 casualties in this system. So this summer, 2018, is the hottest summer for Japan. So in totally, maybe around 90,000 people were ambulance to hospitals. Maybe in medical records, the number of patients to walk to the hospital or everything, such kind of patient is 7 times. So maybe ambulance patient is 90,000. So this year might be 600,000 people might visit the hospitals, I suppose. It is an information system in Japan. So I'd like to finalize my presentation at this time. So we started this information system from 2006, and from 2008, the ambulance system is added. So at first, the number of ambulance people to hospital is around 10 to 20,000. But maybe in previous hottest summer is 2010. In 2010, the number is jumped to around 40,000. And this year, the highest record, so jumped to 80,000. But the remarkable result of this system is here, ratio of severe symptom patients. The first heat wave in 2010, the ratio of severe symptom patient is around 4%. But this year, the second heat wave, but severe symptom patient ratio is decreasing to around 2%. So we suppose maybe it might be a kind of result of our such information system and awareness of heat strokes like this. So okay, the final slide is activities to reduce patients. So using guidelines for heat strokes and heat cycle information system and other private company information, the local government originally developed lots of kind of systems. So in Himalaya, maybe yesterday Ms. Parker is announced, they have an original information system and they spread a towel to cool down for the heating days. Put on the water and cool net. And also in Tachikawa City, they provided a cool spot. Cool spot is small shops or community centers. So they open such kind of system cooling spots in hot day, and they inform the map. And whenever everybody wants to hear, and they can stay there, and in some areas they can drink cold water. And also in Gyoda City, maybe they did such kind of community schools, but maybe such kind of activity is done by maybe mainly by nurse or local doctors. So maybe the remain problem is for Japan is maybe this year ambulance people is 90,000. So it is almost overflowed for the ambulance system. So it is a problem for us. And also the most of people, around 50% people is aged people. So aged people doesn't want to use the air condition or don't want to drink water. So the second problem is how to improve their behavior. And yes, and maybe ambulance people is also 40% of ambulance people is getting home. So this is a big problem for us. Okay. Maybe a little bit information. Maybe WBGT is mentioned in ISO 7243. ISO 7243 WBGT is different from Japanese WBGT because the ISO 7243 has to observe under the sunshine without any ventilation. But meteorological field, we have to observe without any sunshine and ventilated. So the difference is almost 2 degrees in sunny days. So please mention. Yes, that's my introduction.
Time for one quick question, Andreas.
One big comment and one big question. WBGT especially has these problems, and this is the reason because the International Association of Athletics Federation wants to replace him. One of the main factors is one point. The other point, BGT is going to be replaced by the International Association of Athletics Federation. This is a strong discussion at the moment. The reason is because BGT has less thermophysiological relevance in order to handle. This is my comment. My short question is how you calculate globe temperature in the forecast. Cannot you mention that?
Okay.
Yeah.
Okay.
Joke?
So the first question, first comment, thanks for your information. Maybe ISO 7246 is maybe updated last year, I suppose, and they are now circulating in researchers and maybe. And how to calculate the globe temperature is we set on the globe temperature in the field, and we observe the sun radiation and wind speed and temperature there. So we get together the data and calculated a statistical equation. So using such kind. And input is from numerical without prediction model of JV.
I have huge concerns about the globe temperature and also about WBGT.
Yeah, I think so. Maybe also in Japanese case, maybe lots of researchers commented same things. But we started WBGT, so we continue this information. Maybe, yeah.
Right, Virginia.
I thank you for a lovely presentation, but I am told that Japan doesn't have an official national heatwave plan.
Yes.
This is from the Ministry of Health, Labour and Welfare. And I'm really fascinated you're running so much underneath it and you're getting so much data. With the Olympics coming up, do you think you need a national heatwave plan?
Yes, I agree with your idea, but maybe the the Ministry of Heat and Health and Labor is out of our school, so please strongly suggest it.
Yes, please.
I also do.
Okay, last one. Thank you.
Thank you very much for the really nice presentation. I wanted to ask you because it sounds practically as if you're able to work across sectors quite smoothly towards a common goal. I wanted to ask you about the practicalities of how that actually happens in terms of information sharing, evaluating the system, and also sharing co-financing of what that involves. So how did that happen? Would that be a model for some of our other countries?
Thanks for your question. Maybe now for local activities, it's very difficult to share such information. But maybe the Ministry of Environment had a conference, each 2 days conference in early summer. And they invited some kind of a model case for the local activities, such as Gyoda or Saitama like this. And they shared such information at the conference. And also, some NGO has implemented some kind of a contest for which activity is most valuable like that. So the local government and local companies are posted to subscribe to their activity, and such kind of information is evaluated maybe on October. The NGO evaluate such kind of system with the Ministry of Environment, and they make some kind of competition conference, and they a good partner, they get some award. So maybe such kind of with using such kind of motivation, we figure out such examples for the real activity and share on the website. But it's difficult.
Okay, thank you very much.
Can I just ask a clarification on that one? So what was the competition for? Was it for an analysis of what did people respond to?
They honestly said the nomination is very few, so always get same local government good places. So the problem is how to propagate to the all cities. So
Okay.
Spread the good messages.
Okay.
Okay, thanks very much.
thank you.
Thank you. Next speaker is Elspeth Opperman. Elspeth's been working in northern Australia, recently moved to Germany, where she's working in the Technical University in Munich. She's going to speak to us about the broad issue of heat governance, and this has been coming through as fairly important because we've been talking about lead agencies or agencies taking the lead in terms of responsibility for managing heat as a wider risk. So over to you, Elspeth. Thank you.
Thanks very much. I'm going to be a technical social scientist and read copious notes, so please excuse me. As Sam said, we were talking a bit in the beginning before the conference about talking a bit more about governance rather than networks, but then I saw the title, so I've tried to bridge both a little bit. Yes, my turn now to speak up, thank you. So I'll do that now, and as you mentioned, my work has been mostly in Northern Australia, so I'll talk about that. So whilst I was there, I was part of a little team that set up a small network called Heat Stress Research Partnership, which is basically a subnational, regional industry academic partnership concerned with helping organisations adapt to extreme heat in the monsoon tropics. And we formulated this network really in response to some significant governance challenges and gaps that we had in our climatic region. So just to show you where that is, it's the green and grey areas at the top of the map there, the monsoon tropics of Australia. Essentially, national modes of understanding and governing heat and health were quite problematic for us because of two key differences that make our region relatively unique in the Australian context. So first is what happened is basically how we understand extreme heat and when it happens, and the second is in relation to the populations that are seen to be at risk. So until recently, heat waves have been represented with, skipped ahead there. And so we've begun to identify some of the alternative ways of dealing with these to different modes of knowing and governing heat in the region, which take on some of these gaps. So until recently, the first issue has been about how do we understand extreme heat? What is it? So in most of Australia, extreme heat is seen to occur as short spells of particularly hot and dry weather that get characterized as heatwave events. And this used to be represented like this, with maps of maximum ambient temperature, and they commonly have a patterning where the heat wave is worse in the south, it's much cooler apparently in the north. We saw a map like this, I think, yesterday. What matters about this is that the heat risk or the heat health risk is assumed to be distributed in the same way that the ambient temperature is distributed. However, as of course we've been hearing a little bit over the last couple of days, moderately hot ambient temperatures can be extremely dangerous when they occur in combination with high humidity because the body's thermoregulation system doesn't work very well. And when we use an index that represents the significance of humidity, and you're not going to like this, but I'm going to use WBGT because it's there, such as WBGT, we get a map that looks quite different. So this is a map of the same day. I have to admit that this is a forecast and that's an observation, so there's some issues there. But basically you can see that in the first map, the whole of the north is seen to be not at risk. In the second map, areas that were thought to be relatively cool are actually some of the most at risk. Now, this is a commercial product that no one really had access to. This is the publicly available information. All of the heat health interventions and government announcements were all focused on those brown areas. Nothing was being done in the northern part of the country. And yet, if you look at this map, you might wonder a little bit about where we're focusing our attention, where are our immediate reports going to, etc. Okay, so things have changed a little bit since 2014. So as we heard from John Nan yesterday, the Bureau of Meteorology has launched a different heat wave warning tool, which is a much more sophisticated use of temperature to talk about heat waves. And it works, yeah. But basically, it still has some issues. It still uses ambient temperature. And so it works quite well for most of Australia most of the time. But in the monsoonal north, where we have high humidity in the wet season, i.e. for half of the year, we find that the excess heat factor heat wave warning tool basically works quite well in the middle of the wet season where we have quite consistent humidity, but in the shoulder seasons between the dry and the wet season, we might have relatively consistent temperatures but sudden spikes in humidity, and it won't pick those up, or alternatively, it might issue a warning when actually people are feeling cold because we've had a sudden drop in humidity. So there are some issues there about risk communication, about actual perception of actual accounting of risk, but also risk communication and then trust in the public tool as well. So in both eras of accounting for heat in Australia, the basic temperature model and the excess heat factor model, we found that the national discourse obscures some regional climatic differences and therefore provides some insufficient and at times misleading information about heat health risk. And I'm sad to say that most climate change projections information also does the same. It only uses ambient temperature, which is hugely problematic, in my opinion. So there's a second aspect that also matters here as well, in terms of how we think about how heat matters and when it matters. And so the focus on heat waves, whilst it's quite important, can also obscure that in constantly or seasonally extreme heat, whilst there's a degree of adaptation that happens, there are also basic physiological limits to how much we can adapt. It doesn't matter how long we've lived there for. And so there's still a residual level of risk that needs to be attended to. So in sum, basically we've seen that the way heat is conceptualized in the national discourse materially and temporally shapes the geographies that are seen to be at risk, obscuring the monsoonal north as an area where perhaps there are heat health impacts that need to be thought about and where interventions might be needed. So that was the first governance challenge that we were dealing with. So essentially questions of what, where, when, and how does extreme heat matter? And the second question, well, the second challenge really was this issue of who is at risk. And so we've heard quite a lot about this, but basically in the national discourse, largely driven from public health, there's an understandable focus on the vulnerable, the elderly, and the young. And partly that's to do with the kind of data that's being collected. So we have morbidity and we have mortality data. But in Northern Australia, we actually have a disproportionately high young population. So they're not vulnerable in a typical sense, but they are heavily exposed to extreme conditions through outdoor work, and because they're doing outdoor work, they're doing labour-intensive work, so they're also exerting themselves in those conditions. And so they rarely end up in hospital, but what is happening is that there's a lot of unrecognised, less extreme effects. So if we think back to this Emily Chan's presentation on Monday, where she had this pyramid of heat health impacts and service use, we're really talking about those bottom two layers where you get people either feeling discomfort but not reporting, or self-medicating quite often. Okay. And so we can see some of those wider impacts of this kind of low level, heat stress in the bottom half of this diagram. And we're doing symptomatic surveys across the northern part of Australia, and we've explicitly seen some of these effects. So we've seen decreased productivity. We've also seen almost half of outdoor workers stating that their speed of task completion was negatively affected daily or weekly during the 6-month wet season. So there's some big impacts on productivity. And to give you an indication as to why we're seeing those impacts, and this slide I think demonstrates not just what we mean by chronic exposure, but also by chronic heat stress. So we had basically nearly 80% of outdoor workers meeting ALCAG's definition for chronic heat stress in over the 6-month period. So that meant that daily or weekly, they experienced one or more of the sort of more basic symptoms of heat stress, so rashes, muscle cramps, headache, nausea, dizziness, muscle weakness, fatigue, irritability. And nearly half of them had experienced a severe heat stress event, if you like, at least on one occasion in the last 6 months. So they vomited or fainted, felt irrational or confused, had low coordination, loss of consciousness. Now, I don't know about you, but that 80% symptom rate seems to me like pretty shocking. And that nearly half of people have had like a quite severe event in the last 6 months, also pretty shocking. And yet none of this shows up in any of the medical data. This doesn't go to hospital, it doesn't go. Lots of these people will be working on major project sites, mines, big construction work. It doesn't go to their clinicians either for a whole range of sort of economic and political, social reasons. So what we've got are some really hugely significant impacts that are not reported. Okay, so I know I don't have very much time, so I'll whiz through what we've been trying to do about this very quickly, but given our different account of what extreme heat is and our focus on chronic or everyday issues of heat, we've not only been trying to gather various forms of evidence to make that story visible, but we've been doing that so that health interventions can actually happen. And we've also been thinking hard then about, if we're talking about chronic heat, what kind of governance, where do we actually need it? So first thing we've done is by tracing how different types and scales of heat health knowledge governance play out at the everyday level, where people are dealing with this chronic exposure. So we've been tracing down from the national, regional, local, to the work site, to the home, to individual bodies, through which heat stress both emerges through exertion and exposure and is actually managed. And we've examined that through a few different case studies, which are up there. And we've methodologically tried really hard to be transdisciplinary. So we've worked across epidemiology, thermal physiology, and ethnography or social studies, to really look at how heat and heat stress as a phenomenon emerges in the first place through these everyday social practices. And so basically the principle here, and I won't talk about it for long because I have time warning, but basically the principle here is that we don't get heat stress because the weather's hot. We get heat stress because of what we're doing in those conditions, which is profoundly shaped by social context. So if you would like to learn more about this, please talk to me. I could talk about it for a very, very long time. But that's a brief overview of the work that we've done, identifying and responding to the differences that emerge in how we know and therefore govern heat in Northern Australia. And so I guess the takeaway messages really are that we need the right knowledge for the right populations, and in relation to chronic exposure and chronic heat stress, as well as acute issues of heat waves. And to deal with this chronic exposure and chronic heat stress, we need to focus on everyday practices and sites of intervention and adaptation. So I hope that the issues raised here are useful perhaps to other countries that have regional variations of different climates and are trying to put out a national system, so that they can, and also countries with like very different populations, like thinking about like what is that variation? Do we actually cater for those differences? And I think that paying attention to difference just in general of whatever kind is particularly important as we start to talk about broader questions of harmonization globally or nationally, and how to scale up heat health governance. It's not always a good thing if it's not done in a sensitive, appropriate way. So that's that. Thank you very much for listening.
Thanks, El. Fascinating insight into the north, or you call it the top, don't you?
And
The top end, yes, of Australia. Questions for Elspeth?
I'm sorry, it's
inevitable.
Elspeth, that was a brilliant presentation and quite shocking what you found about the workers. Can I ask, does Australia have a heat wave plan?
We've done a review last year, 2 years ago now, that looked at that, and basically no, every state is different.
Do you have one in your state there in the north? So how do you get this information to policy and practice?
Oh, there are so many barriers to that. That's not the only one. So for us,
Gotta do something.
and maybe in the context of talking about networks and partnerships, one of the reasons that we started this partnership is because there was just such a lack of political will, and funding was at the bottom of my last slide there, but there's just such a lack of engagement at the federal level and at the state level. It's not okay to talk about climate change and heat in Australia, period. At the moment, we hope maybe with the next election that will change, but it is basically an absolute no-go zone. That's why I'm now a political climate refugee, having moved to Germany. But what that means is that basically we don't have heat wave action. We do for some states that are more progressive, but we don't broadly have them, and we cannot go to government to have them. If we go to government, which we actually have like a good relationship in the Northern Territory with the Department of Health, Public Health, they don't have any money because they get all their money from the federal government. The federal government says you can't do this. So there's real restrictions. And so going to government isn't the answer. So we went to what might seem like a counterintuitive set of partners, which were basically the vocational educational trainers, the authorities that actually enable them to do apprenticeships, because they actually have, in a sense, their fingers in a whole array of outdoor occupational employers across the whole of the north. And so they're actually quite strategic in that they set the minimum work health practices standards for all of these different organisations. So they're not a health body, they're not in government, they're not doing any kind of regulation, but because of this contractual model, they're actually quite effective players. So that was the in. And we worked with them because we couldn't work with anybody else, but actually the downside of that, which is why the partnership itself is actually now in a limbo stage, is that there's lots of goodwill, but they're not-for-profits. None of us are getting funding to do this work in the Australian context, and so now we've stalled because there's just nowhere to go to get the work funded. So it's an impossible scenario.
Just a quick political context. Australia just let go 300 climate scientists because the view is that we understand climate change is happening, so we need to work more on mitigation as opposed to understand the science and adaptation.
I don't think it was even that good. I think it was worse than that. It wasn't that we have to do mitigation. It was like, oh, we know it's happening now. It was a yes, no question, end of story.
Julie, you want to ask a question?
Yes. Could have been a political refugee myself to France, but I'm still in the U.S. Still going. So, but my question was actually on the governance piece. So you answered part of it in that you did the work in an institutional situation that allowed you to do the work, but not to actually affect change or buy-in in terms of the regulatory structure. So how did you get to, and how could you get to the regulatory part to change some of the policies, or is that really?
To be honest, the regulation is incredibly unique.
Okay.
So Safe Work Australia has a kind of like a gentle slap on the back kind of mode of doing things. They had 4,000 cases go before them in the last few years. They haven't prosecuted a single one. So it's not even like worth pursuing. And so if we had continued to have enough funding to do this work, I think we would have had much more effect doing what we were doing. It's just that we, as academics, we were all on self-funding, we ran out of funding, basically we couldn't keep going. So I think this is the right strategy, it just we didn't have enough
So,
You said Emily, okay.
Oh, sorry.
Yeah.
Thank you very much. That's fantastic. I didn't notice on your set of partners whether there was private sector engagement, and if so, how did you define a potential or possible role that they could bring to the benefit of your mutual goals?
Yeah.
And I ask that because having worked in government in regional settings as well, we always have a very difficult time trying to define that role beyond corporate social responsibility, beyond charity, to have a very active complementary role that government and public sector could not pick up.
So the group training organisations who do the vocational training, they're actually not for profit, and so they were the mainstay of our partners. So I wouldn't call them like commercial, really. We have one commercial partner, but basically it's somebody who's a researcher who's gone out as a consultant. So that's a bit of a different story. But I mean, where we've done the projects, we've done them by being employed directly by companies. So that's where the money has come from to actually do the research. And that's basically been on productivity outcomes, worker well-being, health and well-being. Because we see like a huge, like it's the second main reason why people leave the Northern Territory is because of the heat. And we actually are in a negative population trend at the moment, so it's a massive issue for government and for businesses. They can't retain staff. And that's, I feel like that's the kind of climate change future for a lot of other people being demonstrated there.
So the human capital productivity argument.
Yes, absolutely.
Monty, apologies. Senior moment. George.
Just a quick one. The data you were showing about percentages of heat impacts, is that also published?
There's two papers that are both in review at the moment that are very similar. One is for a company and then one is across the whole region that's in those. So yeah, sadly not so soon. Actually, there might be a paper, a similar one. I could share a similar one with you.
That'd be great. Yeah. I saw that it was in review and took a picture of it. I promise I was doing it. I was like, those are.
Yeah. No, I think we have another one there.
That was your paper for which I discovered you, I think. Oh, okay. My apologies. Okay, perhaps we better move on, because I'm doing a very good job of being late.
I'm just going to tell you, I had Ryan make these.
This
is out of 13 speaking minutes. So if you see 3 minutes, it means you have 3 minutes left to talk, but we still have 2 more for questions.
Okay.
But I was going to see if we get some help with this.
Well, maybe I'll have that response. I'm bigger and meaner than you.
Oh, I don't know.
Talk there. Okay, Francisco, and going to tell us about partnership building related to the Argentinian heat health warning system.
Sit here.
So you have 12 minutes. I will.
Okay.
Oh, thank you very much. Yeah.
Well,
Tom Lee has to go now. So, thank you very much.
Good afternoon. Well, what you supposed, I will read my presentation. Well, I will speak about the early warning system in Argentina as a result of a collaborative work between the Ministry of Health and Social Development and the National Meteorological Service. From 2009, the National Meteorological Service has developed a system of early warning of heat waves and health. Particularly, this system was applied to Buenos Aires City. It was a result of an academic work developed by climate scientists without participation of people of the health sector. The mentioned early warning system had 4 levels of alert: green, without effect on health, population; yellow, it could be dangerous for some specific population, like babies, kids, elderly people, and people with chronic disease. Orange, the risk is increased for vulnerable population and general population. And red, it is an extreme case of heat waves which could affect healthy people. In December 2013, in Buenos Aires City, as well as the north and center of Argentina, an extreme heat wave was registered. Specifically in Buenos Aires City, this heat wave lasted 9 days, being the longest in the record of the Central Observatory of Buenos Aires since 1906. Due to high temperatures, there were powerful blackouts that caused thousands of people not to have electricity. Consequently, there were many protests of affected citizens in the street, as it can be seen in the photo. In the heat wave of December 2013, the red alert was issued, as you can see in the headline of one of the most important newspapers of Argentina. Of course, it is in Spanish. The translation of the headline is "The heat wave does not cease and the red alert remains." This heat wave forces us to contact the National Meteorological Service to develop a more comprehensive approach of mortality related to heat waves. In that context, we were concerned about the sanitary impacts of this heat wave. The collaborative work with the National Meteorological Service involved a research. This study was called Mortality Due to Heat Waves in the Warmer Summer 2013-2014 in the Center and North region of Argentinian Republic, an ecological research. This research was carried out with the support of the Salud Investiga grant from the National Ministry of Health and Social Development for multicenter studies. Apart from the National Meteorological Service, 2 universities were involved, the National University of Entre Rios and the National University of La Matanza. The aim of this study was to analyze and describe in what way the mentioned heat wave affect mortality. We carried out an observational study in order to contrast mortality during the heat waves of the summer 2013-2014 with the same period in the years 2010-2012. It must be considered that in the 3 previous summer periods, not heat waves were registered. Excuse me. Okay. General and specific mortality rates were calculated. To specific mortality rates were carried out in different provinces by sex, cause of death, and age group. Also, relative risk was calculated with its confidence interval. Different characteristics were considered to describe the severity of the mentioned heat waves. There were duration and mean temperature magnitude that had been calculated by percentiles 70th, 80th, 85th, 90th, and 95th of each variable. The conclusion of this study was the following. During the analyzing summer, there were 3 heat waves with large duration and temperature intensity. The mortality during the heat waves of summer 2013-2014 show increases in general mortality rates as well as in the specific mortality rates related to age, sex, and cause of death. The greatest differences between significant and non significant increases in mortality risk were observed in the extreme mean maximum temperature of heat waves. The results of the study, plus the evidence of the increase in the frequency, intensity, and duration of heat waves, took us to develop an early warning system to contribute to reduce the impacts on the health of the population. Once the study was finished, the research findings were submitted to the authorities of the National Meteorological Service and the Ministry of Health and Social Development. Consequently, the National Meteorological Service decided to expand the mentioned early warning system to the whole center and north region of Argentina. Remember that until this moment, the early warning system only applied to Buenos Aires City. Fortunately, it has been a successful experience, which was presented by Natalia Herrera in another session. The early warning system was readapted. Our proposal was to create a new system with more cities and with clear and objective criteria. This is an example of how the current early warning system appears on the website of the National Meteorological Service. Each point in the map represents a meteorological station. The print screen was taken the 18th of February 2018. Different levels of alert, yellow, orange, and green, were observed that particular day according to the location of the station. The system issued a daily alert from the October to March for each of the 57 cities located in the center and north region of the country. This alert is valid for 24 hours. The heatwave early warning system is designed to reduce the available human health consequences of heat waves through timely notification of prevention measures to population. When the National Meteorological Service issues a heat wave alert, the Ministry of Health and Social Development gives recommendations for general population and vulnerable groups. The dissemination of the heat advice to population involves the website of the ministry and mass media campaigns. You can see this recommendation in the slide. In May, we create a permanent work group of climate change and health as an initiative of the coordination of socio-environmental policies of the National Meteorological of the Ministry of Health and Social Development, where I work. The aim of this group is to contribute to develop a national policy of climate change in order to minimize the associated sanitary risk. As you can see in the slide, there are 7 departments of the ministry that are currently part of this permanent group. These departments were chosen because they are in charge of different aspects of public health which are being affected by climate change. As a part of a permanent work group, we are working at present in different communication actions. You can see the communication flow diagram elaborated with the work group in order to inform the state of heatwave alert within the health system. This flow diagram involves different government levels, national, provincial, and local. It must be pointed out that Argentina has a federal system in which the public health sector depends directly from provinces, not from the national ministry. In general, primary health care depends from the local level, while the provincial level is in charge of hospital attention. The national ministry is the rallying agency that establishes health public policies that must be applied in the subnational levels. We decided not to develop a new specific structure for the communication of the state of a heat waves alerts. On the contrary, we intend to use the exciting communication structure between national departments and their provincial counterparts. The future actions we are consider are disseminate the early warning system to the provincial counterparts, elaborate recommendation for implementing action in primary health care and hospital care for each level of alert, document and assess the process. Thank you for your attention.
Thanks, Francisco.
You're welcome.
Questions, please. have a question. Can we go back to the
Yes.
diagram showing the communication flow? Okay, I mean, that's very nice, but it raises the question, who's coordinating these agencies? You've got several agencies here.
Yes.
Is there a coordinating agency?
Mm.
Or is the Meteorological Service just issuing information to each of these agencies?
Yes.
And that's it.
Each of these departments are from the National Ministry of Health, and all of them integrate the permanent work group of climate change and health, and they have counterparts on provinces, and we think that each of these departments could inform their counterparts on at the provincial level, and the provincial level to local level. I don't know if you understand.
Yeah.
Yes.
Questions?
Any movements in order to include or improve the heat warning system to include humidity or other factors?
Yes. When we did the research, we think if include humidity and temperature, but the series of the daily data not is good for humidity, but is good for temperature, and for that reason we decide to use only temperature for the system.
Okay, thanks very much.
You're welcome.
Okay, let's move on now. We're going to look at the US NICE system, the US International Integrated Heat Health Information System. We have Hunter Jones. Shabai, joining you?
No, he's actually presenting those.
Oh, okay.
And now's your chance to get back to me if you want.
I would never do that.
Penalize me for time. I use
Time starts now.
Okay.
Oh, enjoy that.
Yes. So Hunter Jones with NOAA, and I'm going to talk about the National Integrated Health Information System and how we use that to build partnerships and learn what the information needs are to support decision making. And so Julie gave an update, kind of an overview of this on the first day, and so I'll pick up from there and go a little bit deeper. And as I just mentioned, Shibayu is critical in the system as well. CDC jointly wants you to. So I'll start with heat as a multidisciplinary problem. We've covered this a number of times. I'm preaching to the choir, but I wanted to bring this up because it's important to underscore that heat waves can occur at the same time as a forest fire or a derecho that knocks out power. And so resolving heat health problems means that you have to work in an interdisciplinary way. So you have to bring in utilities, energy companies, you have to bring in school districts. We have to keep all of this in mind when we're forming solutions to this problem. So that's part of where NICE came from. The National Integrated Heat Health Information System was kind of launched after a Chicago workshop, which is also kind of where the idea for it came from in 2015 on the 20th anniversary of the 1995 Chicago heat wave. So it was launched as a partnership between CDC and NOAA, and was really intended to bring together all of the different pieces of different agencies, different organizations, even the private sector that work on extreme heat and health, and integrate them and kind of deliver an integrated offering of information that was tailored to the needs of the community. If these look familiar, they should. These are the core research questions that we sought to answer with NIHS. And if you look at them, they're very similar to the thematic areas that we're covering in GIN, and there's a reason for that. NIHS was part of what informed GIN and helped us realize what we needed to do more on the global scale. So I won't go into great detail on these because we've covered them quite a lot with GIN, but I just wanted to give you that context. And again, to put NIHS in the context of GIN, I wanted to show you where it fits in. So of course, we're sitting here talking about the Global Heat Health Information Network at the international scale, but NIHS was designed to be integrated with Jen and vice versa at the national scale, and coordinated by these national agencies like NOAA and CDC. But we also have a lot of regional engagements and local engagements that I'll talk more about on the next slides. So Julie covered this as well. We have an interagency working group that started with CDC and NOAA and has grown to include all these other partners. What I want to point out here, because this is a partnership session, is how this group got started. It was sort of serendipitous. There was a working group formed out of the National Security Council to look at critical infrastructure policy and how heat affected that. And a number of these agencies, actually all these agencies were part of that. And when that dissolved later on, we picked up that group and kept going as NIAS. So we took advantage of something that had already been started and built partnership out of that. So that's kind of one of the key points I wanted to make, is that it's really good to use the existing networks and to not necessarily always have to start over something new and build from what's already there. That group of agencies built the NIAS portal together. So we tried to pull together all of the resources that our agencies had and harmonize them and make them a little bit more usable as a coherent set rather than having to go to CDC's website for something or NIOSH's website for something. So if you want to go check this out, it's at climate.gov.NIAS. It's one of the great outcomes of the interagency working. Beyond the federal level, or well, beyond the interagency working group, we've also engaged a number of other networks. Many of them are at the federal level too. So I just wanted to cover some of the other networks that we're using, that we're in training in NIAS. One of them is that NOAA has, of course, the National Weather Service, which has many weather forecast offices scattered throughout the United States. We use those weather forecast offices that know their regions extremely well to get at the local context of heat. So we know El Paso has different heat waves from Seattle. And so we use what we know from the weather forecast offices to reach those local populations. CDC has brace grantees to Building Resilience Against Climate Effects program. So on the public health side, it's kind of a similar idea. They have grantees in the public health offices that we can work with to understand their heat needs. CPO has RESA, so the Climate Program Office is the research office that I'm in NOAA, and we support a number of regional bodies that do boundary organization work. I won't go into too much detail there. And then NOAA also has regional climate service directors that are they're supposed to know their region extremely well and to deliver improved climate services to those regions. So working with all of those different networks and many others, we now are moving to more the regional focus of this presentation. So we use those networks and we do these exercises in specific locations. You see them start here. Some of these are aspirational. We haven't quite made all of them happen yet, but the North American Desert Pilot in the Southwest and the Northeast Pilot in the Northeast I'll be talking about and what the process was for building those partnerships. So first of all, the one in the Southwest was in El Paso, but it also included Las Cruces, New Mexico, and Ciudad Juarez in Mexico. And we took the research themes, or the NIAS core questions, and we let them kind of have some creative license with them. So you see the themes on the left. They reinvented those and repurposed those as the work streams of that pilot, and you can see them on the right. They actually created this diagram themselves to represent how those core questions could be understood in the context that they thought was most appropriate for their community. And so I think they added infrastructure improvement as one, and all of these core questions kind of funnel into different aspects of these work streams. And the work streams were actually structured this way because of the diverse group of participants that we had in that workshop. So you can see we have the electric company, COFEPRI, which is the health agency in Mexico. We had the water, I don't know where the logo is, but yeah, we had the water department. We had a number of people you wouldn't necessarily expect to see in a meeting, but are all really critical to solving this problem. Some accomplishments of that pilot. The pilot did a lot of really great things. We had some proclamations issued by the cities about extreme heat and health right before heat season started. The one I want to underscore is the promotoras, which are the community health workers in Latina communities. So that's another network, another set of partnerships that we developed. And this group actually put together training exercises for the promotoras to take out to their vulnerable populations to educate them on how to protect themselves from extreme heat. And they went out into the community and did some really low-cost retrofits, kind of home energy improvements to make their homes, some of which are not like properly obstructed because they're living in unincorporated areas, make them a little bit more livable. The downside, one of the things that we didn't quite get to in this engagement, was really understanding what their information needs were at various timescales. It's easy to fall into the short timescale and talk about response to a heat wave when you know one's coming and you're 2 days out. But we really wanted to stretch that out and understand what you need to know at 2 weeks, 3 weeks, several months out, what risk mitigation you could do at those timescales as well. So as a lesson learned, and I just have some of the products that are at these different timescales on the right. As a lesson learned from that first meeting, we had another crack at it in the Northeast. So we did a different process now. We use decision calendars, and this is something that's been pioneered by NIDIS, the National Integrated Drought Information System, which is the sister system to NIHIS, also something that was kind of originated by NOAA and some other agencies. So NIDIS uses decision calendars to understand water resource management challenges. We repurpose them to use them to understand heat health decision making. So we had this, again, very interdisciplinary meeting in the Northeast. And we walked them through this process. So starting with risk reduction, that's the goal, really. We wanted to understand, what are the interventions you're putting in place. So right now, if you're here, you're missing the intervention session, so thanks for being here. But we wanted to understand, what are the interventions that you're putting in place, cooling centers, green roofs, et cetera, things like that. What are you putting in place, and then what decisions do you have to make about how you do that? So where you put your trees, if you have a limited budget, what are the right kinds of trees? Being very concrete here, but those are the kind of decisions we wanted to get to in these sessions. From that, you kind of step back again from the decisions that have to be made to understanding the information needs that support those decisions. And then finally, the requirements, that's when we're getting to the Weather Service. They want to understand just requirements like T-min or T-max and exactly what's needed and at what resolution and what level of skill. To get there, and I'm glad that, I think it was Donald Lee had one of these as well, we tried to speak in the language of the decision makers we were working with. So if you're working with emergency managers, they tend to stick to the short time scale, like maybe a week out. What are we going to do and how do we support an event that's unfolding? But emergency management actually has this concept of this entire wheel of not only response and recovery, which is what we often talk about with emergency management, but also preparedness and planning. So I used their own language to try to get them to kind of stretch the time scale out and think more about, what would you need to put in place if you were going to respond adequately? What would you need to put in place months in advance, maybe pre-positioning assets, to respond better to heat waves? So here's an example of a decision calendar on the left. Here's actually private sector engagement. This is someone from Esri, the makers of ArcMap, who was at the workshop working with us. I just thought that worked really well there. But so that's a decision calendar, just a really crude example of one. But it's basically kind of mapping out these decision diamonds and then putting them on a timeline so we can understand where those decisions are taking place. And then we're also mapping them on the bottom to the information that might be provided to support those decisions. We have a long list of outcomes from these workshops, and here's some more pictures from workshops. The top three are from El Paso, and the bottom one is from the Northeast one. So these are all, I'm not going to read them off, but they're information needs that we identified in these workshops, and they've been kind of field tested by engaging with all these different communities, and that's why it's so important that we do this through these partnerships. Some lessons that we learned from this process. One is that these are complicated issues. So in the Northeast, we had someone there from National Grid, and we were talking about the benefits of planting trees. The benefits of planting trees to reduce the urban heat island. And he said, that's a terrible idea. Planting trees, they're gonna grow into the power lines. The power lines will sag when it gets hot, and then you'll lose power. And so we had a really great exchange about, all of these different interventions have some pros and cons to them. Often when we talk to decision makers, they can't tell us exactly what they need in terms of meteorological parameters. You have to kind of talk to them about the decisions they're making and then work backward from there, and that's a lot harder than it sounds. Seasonal to subseasonal information, that's a new kind of information that hasn't been available before. And so we find the first time you ask someone, oh, what would you do with a week 3 forecast? They don't have an answer. Well, we don't need that information. Well, it's probably not that they don't need it, but that they've never had it, and they don't have decisions at that time scale. So that's something we had to push through, and it just takes a lot of time and one-on-one interactions to get to that point where you can actually engage Finally, I think I covered this a little bit before, but yeah, it just, many disciplines take actions and make decisions on a particular time scale, so I covered that with emergency managers. And getting them to think outside of that box it just takes time and a lot of repeat engagement and partnership. And I didn't leave time to talk about a lot of our tools, but that's okay. I knew I'd run out of time. But yeah, I'll just leave it on this slide. Yeah? Well, I mean, I was just going to give some examples of, on the NIHS portal, we have a bunch of case studies that the various agencies have collaborated on. If you were in Ashley Ward's presentation here earlier, she has a case study from her work that's on the Climate Resilience Toolkit through NIHS. We've done, this is private sector engagement, we've done some work pulling OSHA's outcomes from, they have a database of heat health outcomes, and anytime someone has had, in this example, there's a roofing contractor that died. This is all kind of buried in the database that was publicly accessible, it just never been presented in this way. So we're trying to kind of like let these things see the light of day. This is collaboration with Esri that we've done. The last one, working with CDC, we're using their syndromic surveillance information that they're collecting from health systems all around the country. And this is experimental, but we're using that to kind of do a 1 week retrospective look at how hot was it, and then how many people reported to the hospital in all these different regions.
Okay, thanks very much. Okay, we're breaking into coffee time, so that doesn't matter, because you drink the one coffee. Questions for answer?
Oh, I can't.
Got the name right this time.
The general question, working at the community level, you mentioned pros and cons. So trade-off analysis is, for priority setting, is a major challenge.
Yes.
So that involves awareness of these issues, what they're ready to address, and the capacity to address it. So is there, because most empirical studies look at one driver of change, just for efficiency's sake, have you introduced the idea in community meetings that, yes, well, heat stress is one major issue that we see in the news, heavy rainfall. How do these drivers interact with each other to affect health in a way that might be consequential and give enough attention for a government and the community to pay more attention to? And I ask this because of the priority setting agenda and the need to do trade-off analyses and looking forward to unintended consequences and not being surprised and governments to be blamed by issues they cannot foresee and cannot mitigate or minimize when they have the opportunity to do that from the beginning. That's a long question, but it's about priority setting and doing trade-off analyses with incomplete information.
Yes. So that's a good question, and not just because I have an answer to it. It's a really important thing for them to consider. And so at the meeting in the Northeast, one of our grantees from the RESA program is focused on decision-making. It's its own science, decision-making science. And so we brought them to that meeting. And actually, I was afraid when he gave his presentation because it was a very technical presentation, but I think people loved it because it was basically how do you do a decision analysis? How do you have all these factors and kind of look at them all together, especially in the face of uncertainty? And so we had someone come to the meeting and talk about that, and they chased after him afterwards and wanted to know how they can implement that. So that's a very good point. Yeah.
Another quick question. Yeah.
Does the United States have a heat wave?
You're becoming very predictable.
I am, because I'm really worried. But looking at those figures, it's frightening.
Yeah. So I was going to show you, we have actually, on the left here, we have a map of all the different heat wave plans and where they are. And this is actually something you can find on Jin too. So Jin inherited this idea from NIHS. And so there's a map of all the heat action plans that are out there. And that link might go to this one on the right, but I think we should go into that one. But there are a lot of places that don't have red dots. And it either means that we don't know about the heat action plan or they don't have one.
So,
Or
it's embedded in their multi-hazard plan, which is often the case. It's not pulled out as a heat action plan. It's in a multi-hazard plan, which we also found. That map right there was developed by a crowdsourcing competition that Esri looked. They like, can you find all the heat action plans? So that's partly how that got populated. Yeah. So, but we have the same question in the U.S. and we can't answer that for everybody. Most of the information we had is because we had access through CDC and raise grantees. For some reason, people hold those things really close. I don't really understand. Maybe you guys can work with that more too. But you'd think we have our heat action plan on a website or something easy to find. That is really opposite.
The one for El Paso was private. They shared it with me, but they told me not to share it. It was the all hazards plan. But they deal with some really interesting hazards, and the emergency managers deal with some things that you wouldn't expect, like putting snipers in place when the Pope is visiting, so that they yeah. So they have some really interesting things in their plans.
Yeah, it's not good. Okay, that's probably appropriate for things to conclusion. Just for the meantime, I encourage you to return after coffee. We have two excellent presenters, Ricky from the Red Cross and Virginia Murray from Public Health England, who will both be speaking to the issue of partnership building, capacity building in the context within which they work. And then I encourage you to stay on, because what we hope to do is have some small breakout groups to talk specifically about what are some of the secrets to building effective partnerships. We want to come out of this session with some learnings, I think is probably the best way, about what are some of the golden nuggets, the sweet spots for building partnerships, and how we can use those learnings to help other people in simple terms learn about how to go about building management systems which are based on effective partnerships or marriages between critical agencies, critical people, so on and so forth. Okay, copy time. Thank you.
Yeah. I think that's even something like share like the URL.
Sorry, what? Really what?
She wanted a picture of one of the slides.
Yeah. Now I know you're joking.
So you can see if you can find it.
It's a kiosk, isn't it?
15 years in Unity. No, I was living in this.
It's not perfect. We know it's not.
We just have a couple
I had this conversation with Johnny and I'm not a meteorologist, so I don't know what data we have yet. But I don't know what data we put in these kinds of systems. But it's really fantastic to talk to
After I said it, I was like, do you know what I meant?
I just think we have to change what we do. Your presentation is kind of depressing.
I kind of figured this out.
You write it up and you share it and you tell everyone and we bully. Hunter, that was great.
Oh, good. Thank you.
Hunter, but can we just go back into that? I just think.
And I have if you want that slide.
Can I go and have a look at this?
And I'm just like, write it up and we put it to share it and nothing happens.
So
Yeah.
It's just,
That's genius.
that's why I'm asking this question.
Genius, right?
oh, and then you just leave. I mean, like, how still
Situation at the top end,
It's a good spot for you to be.
Right.
So you've got lots of people
despite what you think of
do. I find
WGT. Putting those two ones side by side.
Yeah. And I'm sad that it's the because like
in the US, oh yeah.
Yeah, it would have been a nice reaction.
and it's
He doesn't like it.
and it's and you were correct to point out the issue of like laying off all the media
I have one
rights.
more
I've got
subscribers.
yes. I just
So much for the
I know.
I have one experience. And so
Yes, that's right.
If you ever think of changing your name,
Thank you. I'll come back to you on that.
That's too short.
yes,
Sorry. Thanks very much for the
no,
And he's given me 15 minutes.
Okay.
It's very nice of him.
But you were so right to bring up the ideologists.
I know.
I think this is actually very revealing. This discussion, these debates really are revealing. I now know what I'm talking about tomorrow.
Good.
Finally.
This is exciting. Yeah. You know, they originally had me doing the great debate up against you, and I was like, I can't go against Virginia.
Why?
Because the level of experience, the knowledge. So you're gonna go up against Shannon. She's gonna talk about the law.
Well, I'm going to talk about how we can get governments to buy.
Yeah.
That's the partnership I want.
Oh, was it Japan? Way to us to buy products.
Exactly.
Advice.
Yeah.
A little shaming, I think, is no bad thing.
It's not actually a national
No, yeah, so I think it's two
information.
different things. So one is that they have to be asked to provide information, but he was saying earlier also that there's a sort of advisory group that is
No,
talking
not
about
at all.
translating the EHF into actual heat wave planning. And so the person that we work with in the Department of Territory and so we raise all these
It's so different. As I say, like,
It's worse.
yeah. I think I give it my word.
holding it up. Really, I don't have like, but if they can collide or politics is always crazy. I don't know what that is. Mostly it's not territory and things like that.
So your comment about why you left Australia, is that a throwaway comment or is that
No, it's a serious
genuine?
So that right there is the example of
we
clearing
like
everything else
like
to take
kids
through, right?
basically don't know. I mean, what I miss it's really sad.
Yeah.
And like so we got to the point of producing it.
That's true.
Stress management app.
Yeah.
Weather tool because there wasn't one available. And
So-
like, why are we doing that as academics on a
Your
$10,000
experience
budget?
is diagram I showed this morning.
But
Make
that
it so-
means that there's no direction almost, I suppose.
It's like really
I
good.
wasn't fishing for.
No, it was really good. It just pulled, you know,
Yes.
you can get those ones in the city.
Right,
so
everybody's
it's really pulled
doing
things
their own
together.
thing and then
Great.
can work together.
Yeah.
Your life I can't do it. Plant told
Is that right?
As compared to.
Yes.
And that's why I think that's why,
But
and it's often so hard to.
24 hours ago, I got my pack. Like that on many things. Different time. Great for the appetizer. Oh, okay, well, thanks for that.
I'm trying to do better.
Yeah, we need some caffeine. Right.
Society thought.
Oh yeah. There's no way.
I think more to do with the concept of working with our partners at the same level. Yes. Not always. It's the easiest. Exactly.
Well, if nihis is the way you live, Jim, brilliant.
We
It's
did,
an
yeah.
incredible outcome.
Yeah.
I really congratulate you, Hunter. No wonder I know why you spent so many hours on the phone and emailing me.
Yes.
And others. We really have to change this, don't we?
But I'm optimistic.
I think so.
This-
I think by having this network.
This came together so nicely. It was a scramble. It was a lot of, we had a lot of good conversations, but I think it was totally worth it.
Are we able to? Will we have copies of these slides?
Yes.
I think that it was particularly important, the Japanese one.
Yeah, I saw a lot of people taking photos.
I know, but I haven't taken. It's very hard to take them in the right position.
Mhm. No, we'll share them.
Can I just see if mine work?
Yes, I think I have yours here.
It's all clean, so. Oh, it doesn't work.
It might be turned off on the side, on the left side. We have some backups upstairs. How's it going?
Very good. Trying to stay awake.
Yeah.
No, it's not.
I was so tired. I was like, what if I can't even stay awake for my own presentation?
Don't worry, I have been to China on one occasion when I went with a broken leg. And in those days, you would do a few slides, the old-fashioned slides. It was a long time ago, 1990. And I managed to, when the translator translated, I went to sleep. I just got off an aeroplane and it made me start talking at once. And I thought, this is dangerous. Can I go have some sleep first? I thought that was quite cruel when they did that to me.
Yeah.
This isn't working.
Okay, let me take a look.
Can you bear to?
See, yeah.
But I hope I've got a great story to tell. I'm trying to make it fun. Oh, you made it work?
Oh, that was me doing it manually.
Pretty
Oh,
that I'm not going to catch your talk because I have to be doing notes upstairs.
No, that's fine. You'll have a copy of it. You've got the paperwork.
Wow. Okay.
That does work. Yes.
I'm interested in emergency management stuff, so.
That's what I do. That's what I've done.
And that's
for
what I'm
years.
trying to start doing. So.
Okay. So back to Sendai. So you don't have a national risk register of civil emergencies yet in the States. So we have very boring outside with glorious inside, colour and drama. And this is something that's been used by the UN as a real sign-off. So you identify what the problems are, affects by groups, assess health, psychiatric impacts, economists versus social disruption. So health is really strong in there. It makes such a difference. We are so powerful there. Then all the chief scientists prioritise, and then we have a cross-government steering group, and then it goes to a sign-off.
How's it going?
Civil service.
Yeah.
And the Prime Minister signs it off.
Good. I just finished my talk, so I'm
at a
officially
local
done.
emergency
I'm gonna take
management
that. Right, we're done.
But I think it shows when we showed you.
Maybe.
Yeah, you can come back and help me.
No, Virginia's gonna school me.
Yeah.
She told me she's gonna school me after
Yeah,
seeing
you know that Virginia's nickname is Mary Poppins, right? She pulls an amazing library out of her magic backpack. Anywhere we go. It's unbelievable that you don't have back problems from carrying this mountain around. I agree.
The overlaid heat waves.
Are you leaving this for me?
No.
No, it's going back into your library.
You can't have it.
No, of course you can have a lot of it. It's all publicly
We
available.
do actually have.
Have you seen this? It's called the slide
Yes.
set.
I don't know if I've seen the slide set. I am familiar with that. We need to rewrite and update that.
Is it not? This has just only been rewritten in December 2017. I went to Durban. done something similar. But I haven't included.
Who's up first?
Other bits. Yes.
FYI, we're already creating some working groups upstairs, doing some handouts, sign up, put your name on this if you want to continue working on X. Might not be a bad thing to think about doing.
Are you doing the sticky note thing?
We said let's do it properly tomorrow morning.
Okay.
So we do them all down the hall, and people can actually go station to station rather than a bit ad hoc.
Yeah.
So
sounds good.
Yeah.
We'll lose some people tomorrow, but that's okay.
Yeah. Yeah. Unfortunately, we don't have the survey yet. That's the big thing that I should have done.
But it was the after workshop survey anyway, right? I mean,
No, it's the member survey, which should have been up this morning.
yeah.
And I couldn't get Julie to even look at it.
She's in here. Do you want me to?
She has now looked at it.
Okay.
It's mediocre.
The
but
survey.
It's something better than nothing. So I guess we should just do it.
Yeah. Do you want
I'm gonna have
to? Do we? Yeah, we don't have a closing session. We just let them go. Yeah.
Exactly. And are we set for like date? And we have our tea late.
Yes,
Yes, after this. I haven't given you one.
All right.
All right.
With the band. In return.
Wasn't sure how it would switch over from the other.
Looks like it worked pretty well.
Oh, this is the reformatted one, so yeah.
Yeah. And Virginia's got the clicker.
Oh, okay.
Oh, thanks. Sorry. I'm looking forward to seeing it. I know exactly. I can't, unless it's the event thing, it can't possibly be air conditioning. something. You have? Anybody? Can I get you a quick cup of coffee?
Oh, it's okay.
Are you sure?
Yeah,
You look a bit coldy.
a little bit.
Can I get you a cup of coffee?
Yeah, this is the time for coffee back home.
Sorry?
This is the time for morning coffee back home.
Yes, you're just about waking up. This is well, yes. It is about your heart back.
Oh, this is where you switch off the AC.
Someone ring the bell?
Yes, please. Do its thing.
So, hi, rent an audience.
Sorry?
So, gathering people. Okay, it's around 5 minutes past 4, so perhaps we should get going. My pleasure to introduce Julie Vicky from the Red Cross, who's going to be talking to us about partnership and capacity building related to heat, but also I think some broader lessons related to other issues and challenges that the Red Cross deals with.
Yeah, sure. All right, thanks everyone. Yeah, happy to be here and talking about what the Red Cross is doing on heat. And I know there's a lot of Red Cross colleagues in the room as well, so if there are follow-up questions, we have a strong contingent to give a variety of answers. So generally, the next few minutes, these are the three key things I'll mention. A couple of examples of what we're doing, it's not exhaustive. A few recommendations, and some invitations to collaborate. And a quick shout out to the photographers that are here. This is one of their photos. I thought it was really, really nice. Check them out on the Google Drive if you haven't already. So one example is a partnership. These are project level partnerships, so they sort of had a start and an end date. in Nairobi. This was with these actors, which are here, so American Red Cross and Climate Center, as well as Johns Hopkins University of Nairobi, Virginia Tech, ICPAC, which is intergovernmental body in East Africa, and the Kenya Red Cross. This was looking at what is the heat risk in informal settlements in Nairobi. It was commissioned by the Red Cross to try and answer this question to understand it better. It fell under a larger technology innovation project, which I'm not going to get into. That other project had another 20 or so partners in it. But generally, the findings here were quite interesting. But to summarize them down, essentially the informal settlements have significantly higher, in some cases 5 degrees centigrade higher temperatures than the central monitoring station in Nairobi, which would typically be used for heat forecasting. So not only showing microheat island effects, but raising the question of how do you target some sort of early warning system. What we weren't able to get in this case was correlations with public health information to really be able to say what is a threshold where we need to issue a warning, and then by extension the actions that a Red Cross volunteer can take to reduce risk. So that's an open-ended question. If anyone has particular interest in Nairobi, that's a great question we would love somebody to solve. Another example of collaborating around research into this case actually action was a study that the Climate Center was involved in along with the IRI, Columbia University, Mailman School of Public Health, and BBC Media Action. How this came about, some of you are familiar with perhaps Hannah Neeson's research around forecasting in Bangladesh around heat risk. We also came across it as the Climate Center, and we posed another question, which was, can you tell us how many people have died of heat waves over the time period that you were looking at? Because from an advocacy perspective, this helped us a lot more to be able to say that this is an issue that needs addressing in a place where it's not a well-recognized issue. So that's what they did. The first two partners here, IRI and the School of Public Health, their preceding research had local partners in Bangladesh as well, but they just reassessed the data essentially that they already had. They came up with this, which is that during this period of information that they had, 2003 to 2007, roughly 1,500 people died per year, with a risk that people weren't really aware existed in the first place. So then we took that information and partnered now with BBC Media Action to run a Facebook campaign targeting youth, specifically asking youth to make sure to check on the elderly. So that's why youth was the target. It ran for a month, and it reached 3.9 million people with 2.7 million video views and 742,000 engagements. Engagements in this case means likes, shares, comments, etc. In the discussion boards, so there were a series of like weekly products that were put out. In the discussion boards, people were primarily focusing on health and city planning. So it was a nice to also see not only the short-term time scale, what do I do for my particular loved one in this particular health situation, but also from a city planning perspective, what do we do to reduce this risk in the longer term? So that was a really great example of another collaboration. Again, there are other heatwave work collaborations that we have had in the past. I'm not going to get into them. What I wanted to actually share next is not heat at all. I'm a slide too fast. These are a couple of other examples of things the Red Cross has done in the past. If you're thinking about in your country context, how could you connect with the Red Cross? These are Indian Red Cross volunteers who are doing a flash mob in a busy market in Delhi during a heat wave to raise awareness. They then did the same flash mob in the airport to raise awareness among people who are working in the airport. Yes?
What's a flash?
Oh, sorry, a flash mob. So basically, you can imagine a busy market area, and then imagine, I don't know exactly how many they have, let's say 20 volunteers that have coordinated steps. And so they go into the middle of the market, and all of a sudden they start doing certain moves in coordination. And in this case, they also had some verbal cues that went with it. And basically, it causes everybody to stop and look, because all 20 people are doing the same thing at once, what's going on. And so they did this, and it included messages that there's a heat wave going on, and these are the sorts of actions you should take to reduce your risk. And then they did the same thing at the airport. Coincidentally, the manager of the airport happened to be in the market and saw the flash mob, and then said, "Can you come to the airport tomorrow and do the same thing?" Yeah. And then in many countries this is common. This happens to be a Dutch volunteer, but this is very common in a lot of places where there are sort of checks on the elderly, distribution of water, etc. Hong Kong Red Cross will be talking about their heatwave work tomorrow as well. So these are some examples of things that the Red Cross will do in different places if you do ever want to collaborate with the Red Cross on heat. This is the one that I was going to say has nothing to do with heat. But I wanted to put this out there as an idea. So this partnership, the Measles and Rubella Initiative, has anybody ever heard of this partnership by any chance? So this partnership was founded in 2001 to also address a public health issue. It was initiated by the American Red Cross, and it has these other partners that are founding members, CDC, World Health Organization, UNICEF. And the basic goal of this partnership was we need to eradicate measles. Obviously, it hasn't been achieved yet. But when the partnership started, there were roughly 550,000 measles deaths per year. And today, in recent years, it's dropped under 100,000. And over the course of this partnership, 2 billion vaccines have been issued, and roughly 20.4 million lives have been saved. So I put this in here to pose a question to all of us. How can we be very aspirational about reducing heat deaths? How can we go beyond trying to do smaller initiatives to something much larger and much greater, where we can at some point quantify the number of lives that have been saved at a global level through a massive effort? There are different contexts. Vaccination is different from heat action. At the same time, I think there's some basics that come out of principles and out of the ambition of trying to reduce deaths at a global scale that can translate over. So that's something for the discussion groups, perhaps. Tips on a successful partnership. I'm not going to read all of this. It's one of the questions for the breakout. It's what makes a successful partnership. There's actually a lot written about what makes successful partnerships. A lot in case studies and gray literature, white literature. But these are some of them that I pulled out that I think are particularly relevant. Some of them seem really obvious, but are not always done, like defining a clear vision. You'd be surprised how many partnerships don't actually have this and fail because of it, even though it seems incredibly obvious. Being able to have a concise pitch, being able to make sure that your members are very complementary skill sets, so you're not you're not stepping on each other in the process, etc. Building on each other's ideas, making your partners look good. That's not at the expense of technical quality, but trying to work together to make each other look good. So those are some tips. And to just 2 more slides to conclude, a couple of invitations to collaborate. One of the things that we're working on, which Ruth is very involved in, is developing this heatwave guide for cities. These are some of the partners that are involved in some degree or another, mostly in technical review of the guide, with ICLEI being an association of city governments that is involved also in the writing of the guide. There are many more as well. This is not comprehensive. It's already gone through a first round of review, and the next draft is being updated. But if there's anyone that really feels they would like to be part of this, you're welcome to still be part of it. It is a guide for city managers, and it is a global guide, but it is targeting specifically cities in Africa and Asia. Especially because when we look at maps of where there are different actions going on and where there's different research going on, those are often where there's a lot of gaps. So that's why we're focusing it here, but it will be globally applicable. It will be very simple. So one thing to note, many of us are aware of the WHO guide for developing heatwave warning systems. This is not meant to be a duplication of that. It is meant to be a quick reference guide that will direct you back to more detailed guidance like the WHO guidelines for heat warning systems, but is more concise for people that really just want a basic introduction. The other one that we're planning to do, let's say in January, and if you're interested, you can contact me or Ruth as well, is an invitation to a heatwave sign-on letter. So the idea behind this is, again, to try and fill some of these research gaps and action gaps that we've seen and we've been talking about. This is essentially, it will be roughly a 2-page letter that outlines the importance of heat risk, some of the research gaps that exist at a very high level, and it will be an open letter. The idea is that we want to have as many organizations as possible sign on, and the letter will be something that you can then use when applying for funding somewhere to attach it and say, look, I want to do work on heat waves. I'm seeking funding from your entity to do that work. And here, as an attachment, is a letter that has 100 organizations saying heat waves are a serious issue. And this is sort of our collective endorsement of that. So it's meant to just try and get additional funding into the topic in general. Because as a Red Cross, we want to be able to do something about it. And some of that involves filling some of the knowledge gaps. In other places, we can do things already. Some places, we need a bit more knowledge. So that's the goal of this letter. And if you want to be involved, just let me know. And I believe that's the end. Yes, that's the end.
Great, thank you.
Thank you.
Questions for Julie? I'm going to ask a question. Your rubella measles example, setting aside vaccination, can't vaccinate against anyway illness. You had some very impressive agencies up there who formed the partnership.
Yes.
So Red Cross.
Yeah, WHO, CDC.
Yeah, WHO, CDC, etc. At what level do the conversations take place to engender a partnership like that? Because a mere mortal like me, I don't think would be effective in banging heads together to get these people working together.
Yeah.
So at what political level does this need to happen? Because we do so much at the grassroots about partnership building in the local context, but to provide the political context and political will, I think all the talk's going to happen. It's kind of the stratospheric level.
Yeah, that's a great question. So this partnership happens at multiple levels. So it happens at the global level, definitely between these organizations, and it happens largely at the technical level as well. Sorry, before I go to technical, when you say national level, it happens as well. And then it happens at a technical level. So to give an example, this is a volunteer, a Red Cross volunteer in Zambia. So just to illustrate an example, American Red Cross will partner with the National Red Cross or Red Crescent Society in whichever country. And the American Red Cross will take the role of training volunteers about key messages for vaccination. And then volunteers themselves, in collaboration with their National Red Cross or Red Crescent, will essentially go to their communities and their neighborhoods, because they're all throughout the country, and start convincing parents to send their kids for vaccination. In parallel, the World Health Organization, for example, will work with the National Health, Ministry of Health or equivalent, not only to ready vaccination clinics for this influx of children, but also preceding that to make sure there are vaccines there, which is part of readying them. But essentially work with them in between these campaigns. And each partner takes a different role in a similar way at a national level. In the case of these campaigns, they happen once every 3 years in the relevant countries. And that's just the right vaccination schedule in this case. And then there's also, in addition, for example, there's an annual meeting of this Measles and Rubella Initiative that happens in DC, which brings together more senior technical people to talk about the challenges facing the partnership. And then, well above my level, there's, of course, also conversations happening in leadership among these organizations. So I do think that the model, though, of partnership, in order to reach scale, sorry, that number is here, is an interesting one, because you have each entity taking a very specific role that is its core strength. So, Red Cross system alone cannot vaccinate kids, right? But a volunteer who lives in this community and probably is friends with the parents of these kids can borrow these kids for half day to walk them over to a vaccination clinic and make sure they get vaccinated, right? And as long as the other partners are doing their part to make sure that that clinic is ready, then the whole system works, right? So that's sort of what this model is meant to inspire. Heat waves are very different, but I do think that we can be aspirational and try to think about what a similar sort of initiative would look like to reach these kind of numbers on the heat front.
Any other questions?
Yeah.
On this one, do you
Yeah.
incentivize the volunteer or anybody within that community at all?
So it depends. What I can say is, I think now, because of inflation. So it used to be for a long time, it was $1 per child to do this vaccination, and that covers everything. I think now with inflation, it might be 2 is the estimate that we're using. Red Cross volunteers in many places get a small incentive, but it's to cover like lunch during the day, just like you would get in any other organization, and a bit of transport if they need it. But apart from that, no, it's a voluntary service with that little bit of, allowance for lunch, basically. But again, they're volunteers living in their community. They have an interest in making sure that their kids and their neighbors' kids don't die of measles as well, right? So there's a strong motivation there.
That's fantastic. Thank you. Right, my pleasure to introduce Virginia Murray, Public Health England, who's been intimately involved in developing the England Heatwave Plan. Virginia is going to talk about the specifics of that partnership building, but also talking about some wider issues related to risk in the UK and partnership building process related to that. Thank you, Virginia.
Thank you, Glenn. I'm doing this on behalf of my wonderful colleague, Ema O'Connell. Ema has just been appointed as interim head of extreme events and health protection at Public Health England and is very sad not to be here, but she is the current lead of this team. I started and led this team from 2011 to 2014, and then handed it on to Angie Bone, Tom Waite, and now to Ema. So this is a story of how we've all tried to work together, and most of it comes from how we've been working across government. So the first thing to remind you is the Sendai framework. This is the driver for how we deliver this. It has been incredibly powerful because what we have to do is reduce mortality, and heat waves cause mortality and affect people, result in economic loss, damage to infrastructure, particularly transport and education, but also we have to have a national risk register. We work with international cooperation, and most importantly, we need effective early warning to do it. So let's have a look at the National Risk Register. This sits on the government website. The last one was published on the 14th of September 2017, and it looks really boring. But inside, it is gorgeous. It's full of colour, and it's full of communication mechanisms in it. But I do think they could have done better on the outside. What it covers are risks in foreign countries, because of course people can get exposed to heat waves overseas, but also our own natural hazards, and includes our heat waves, which you can see diseases, major accidents, societal risks, and malicious attacks are all in there. How do we map it is something really important. What we do is to compare it with likelihood and impact, and we look at 5 years. So you can see that we even map an earthquake in the UK. Not that we believe in many, but we have 1 or 2. They're not really very exciting. The worst one is pandemic flu. The next highest nowadays is cold. Only 2 weeks ago, we announced that in 2017 to 18, in our winter, we had excess winter deaths of over, wait for it, 50,000 people. And that's just England and Wales. Really terrible. So it shot up to this high part of the agenda, but that is our country. Why does it matter? Because we can bring all these different things together and see where they fit and which government department takes ownership of each of these problems. We all have to contribute. We all have to do this. We work across the whole of government, and for instance, wildfires goes to our Department of Local Authorities and Communities. But you can see that we work at many different levels, and this is how we do it. So our National Risk Register identifies lead assessors and expert groups, assesses through health specialists the casualty and fatality figures. It also looks at the economics, the social disruption, and the psychological impacts of these problems. Then it's prioritised by our chief scientists with a cross-government steering group, with the sign-off of government, finally to the Prime Minister. So these plans get signed off at the highest level in our government, even though our government is perhaps a little confused at the moment, but I certainly wouldn't say anything about that. But this is a mechanism respectful, and is published in the National Disaster Risk Assessment by UNISDR as a model for other practice. And it also comes up very clearly as something that every country must deliver by 2020. So you need to engage in this process. So, as yesterday was said, we in the north, in Europe, rather like heat. Unfortunately, it kills. And the real time it killed was in 2003 when we had this terrible spike of deaths. And that was published by our Office of National Statistics. So it was data that changed our thinking completely. That spike really upset government at the time and resulted in the fact that we needed a heatwave plan with a series of steps for the whole of our national health system, our local authorities, our social care, our public agencies, our professionals working with people at risk, particularly our NGOs and INGOs, and thank goodness for the Red Cross. Red Cross, and thank you for all your contributions. Individuals, community, and the voluntary sector. Because you saw that this heatwave plan for England is an important component of long-term and emergency planning and looking at the impacts of climate change. So the heatwave plan, in its glory, is pretty simple. Anybody want to have a look? It's available. You can come and play with my toys later. The bit that I like so much, because I'm a nerd, I really am a nerd, was making a case. Why do we have a plan? This is where our wonderful academic partners come in. They help us to work across all the science to simplify it and turn it into a simple resource to explain to people why we need a plan. Because nobody wants to plan if they don't know why. But equally, through our incredible emergency planning communities, we have really good messages. We have a really good message for people who are not necessarily very literate, and we have very good images. This is designed for a reading age of 8, but we know that we need it in other languages as well. But we have advice for people who are particularly vulnerable, but we also have advice for people living in healthcare homes and other places, as well as looking after themselves. But we can't do this without our partnership, Rosa. So what we have is a natural hazards partnership. It's the UK's trusted voice for coordinated natural hazards advice. And you will see that we have many people there, including Public Health England. Oh, we'll be proud we got in there. But the Met Office with all our partners working together to the Cabinet Office, which is where the Prime Minister sits. So we report to them through Scotland, through Wales, through our space agency, through all our different partners, come up with information. So every day, a daily hazard assessment is published, at least once at 2 o'clock. But if other hazards appear, we'll get more. And what you have here is something in amber and yellow. The first one is aeroallergens, because they're really worried about the amount of aeroallergens. The next one is extreme temperature, which is amber, but we have air quality yellow and wildfire yellow. So let me take you to what a heat health watch alert looks like. And you'll notice there's a particular part of the country that is most vulnerable, and that is just up here in our north, not far from Durham, so quite close to you. But we also put out the air pollution messages. So everything comes together in a single document, and this goes to all our emergency plans right at the front line. You have the green, yellow, amber, and red that was explained by our wonderful colleague from Morocco. We use exactly the same system, but Rosa mentioned yesterday all the different forecast systems that we have to bring together this particular process. Now, that's the heat health alerting system, and the alerts get cascaded by email to the local communities, from central government to PHE centres to NHS England to local authorities, and of course to the media. And it goes right down into the local resilience forum, local health resilience partnerships, health and social care organisations. And the whole purpose is to have different mechanisms of sharing the information. And you can see how we try and use everything SMS, radio, web, TV, email, any mechanism to try and make sure we get the message there. And what we have are 5 levels of heatwave planning. This is the one we fought for and got finally agreed, even though the Cabinet Office didn't want it, which was long-term planning. Because there's no way you can cool homes unless they're planned throughout the year. But these are where the main things come in. Level 1, which is heatwave and summer preparedness. Please note the 1st of June to the 15th of September, because that will come up later. And then we have heatwave level 2, forecast, action at 3, and 4 is a major incident. And that's we do anything to keep out of that, because that means you're suddenly in the Cabinet Office and being grilled, and you'd rather not do that. So this is the level 3 action, and you can see our partners as commissioners, providers, community and voluntary sector, and the national levels, and the clear messages we try and give of what we expect people to do, and how we expect them to help us. And this is all agreed in advance, and they've been asked if they will, and then they sign up to it. So let's go to the heatwave of 2013. Quite warm, even for the UK. Busy month, wasn't it, in July? So we have a PHE syndromic surveillance data sources. So this is another partnership. A partnership of many friends and colleagues, which ranges from primary care and general practice, social media, GP in-hours, healthcare worker absenteeism, web activity, what people are looking at, GP out of hours, ambulance, emergency departments, telehealth, and even over-the-counter sales, so you can swap people buying sun cream. I know it's not part of the heatwave plan, but people do like to go and sit in the sun and then they get burnt. But how do we pull that data together? So with our wonderful friends at the Met Office, we get a central England temperature, that black line. Can you spot a heat wave? Anybody volunteering to say heat waves there? Silence. Oh. Didn't do very well. Well, we have very clear thresholds. So we have a heat wave alert plan, as you can see, and we suddenly pinged on the 13th. As you saw, that message came up with amber, and we went to level 3, 2, 3, 2, 3, and then we had a 2 there. Did we get it right? Let's see. Well, you can see that we possibly didn't quite get it right. NHS Direct, our telehealth, had a bump before we actually got the level 3 right. Emergency departments, mostly we got it right with the level 3. With our GP out of hours, we possibly missed the first one, but we got most of it later. And then again, we had the same problem with GP in-hours. But that syndromic surveillance only kicks in every day when we go to level 3. Otherwise, it's weak, so we were a bit late at that time. And of course, this has been published, like everything we do. Why did we think it was really important? Well, let's look at the 13th of July to the next point. So let's plot that dotted line of the 5 to 14-year-olds. This bubble. What happened, do you think? I was responsible for the plan at the time, so I know I can tell you what the problems were. What do you think happened? It's July, school time. What happened? What do you think? How do people get exposed? Why do we get that bubble between 5 to 14-year-olds? Sports days, prizes. We didn't talk to schools when we did that plan that time. We now do. We've changed our practice, we've worked with the Department of Education, we've provided guidance. We can tell them to stop the sports day. We can tell to change the time, change the hour, change the day. At last. But we also looked at mortality, and you see within the break that red dotted line where we would have identified those people who have died. So we were really concerned. So now let's take you into the next plan that we have. We have a national adaptation program, and this is the 3rd time that we've issued it from our climate change strategy, and it came out in July this year. But we also have the Heatwave Adaptation Committee. So this is the Heatwave Adapting Climate Change. This report was asked for by our House of Commons, our House of Parliament, was asked for by their Environment Audit Committee, they asked to see if we were delivering. It came out on the 18th of June this year, and there were a few comments in it. One of the major comments was that heat waves don't just occur between the 1st of June and the middle of September. So PHE, Public Health England, has been asked to reply to this, and now there's going to be a single plan for heat and cold, so we have the flexibility to call a heat wave in April, but to tell you it's freezing in March. We can change it because the seasons are changing. And one of the big outcomes has been that we've now, through that mechanism, finally got to the Ministry of Housing, Communities and Local Government to ask about how we improve overheating in homes, but also cooling and warming in homes. This partnership that I try to demonstrate is only due to the incredible commitment of hundreds of people. Graham Bickler was the person who started it. He is the partner of our wonderful but he talked to people inside the Department of Health and the Health Protection Agency. EMA now runs it. This is our wonderful natural hazard partnership. It's just some of them. Shari is one that represents our academic partners. But the Cabinet Office colleagues who helped drive this and many others have all engaged. This is a nationwide movement.
Right, I'm sure there must be questions for Virginia. Anything else?
So, Virginia, how and why did your House of Commons and members of Parliament get interested enough to ask for that?
I think there have been some complaints. I wasn't involved in that because I now do global disaster risk reduction. I just heard about it on the sidelines. Our medical director and head of health protection gave the evidence along with the Minister of State. So the Minister from our Department of Health to respond to the questions. And one of the questions was a complaint from the National Health Service Foundation saying, we had a heat wave in April. Your plan only kicked in on the 1st of June, for instance. There's overheating in our hospitals. Can you change the research? So now there's a huge research campaign, which I haven't shown you, about how we try and deliver this. There are lots of these tweaks and engagement, which means that the government owns it. Isn't it wonderful? We may not have got it right, but at least it's there and not going away.
So I was asking, how did you institutionalize it at that level? Because
it's quite good, wasn't it? Sendai has helped hugely. Our government has really signed up to Sendai, and Sendai asks for us to do an all-hazards approach. This is just one plan, which will end up with an extreme weather plan, winter proposal. It's going to bring in all the extreme weather events. So it will be one system to deliver all of this. So the evidence will change.
Oscar.
Just wondering if you've observed that there's something unique perhaps about the UK government structure, perhaps thinking about COBRA and the position of the Cabinet Office to sort of oversee at a national scale these sort of complex emergencies. And if that's what's enabled this kind of incredible buy-in and systemic approach to this particular hazard. Because I don't think we see that in other national contexts as much. I mean, the US is better too, but...
Well, I think to us, we had a real problem. We had bits of legislation all over the place, and us who were working in emergency planning, response and management were completely confused. You had this bit of legislation on drinking water supplies, that on power outages, this bit about coastal defences, and we got completely muddled until in 2003 they brought in the Civil Contingencies Act. It was a piece of legislation which identified Category 1 responders and Category 2, but it meant all of us knew what we had to do, and we had to respond to any hazard. It was an all-hazard approach. And that made it so different for us to be able to plan and prepare for any event. And we practiced, we played, we exercised, we used it routinely. We have a system called operational, tactical and strategic, which we also call bronze, silver and gold, which is often easier for people. But bronze works every day at the front line. The children who died in a house fire, that was a bronze level response with some silver response yesterday. We know this system works. It only goes to gold and then to Cobra when we have possibly the biggest fire since the Second World War, like Buncefield, or we have a little bit of unexpected nerve agent, or a polonium, or a monkeypox, or something going on. We have an adventurous life in the UK, but we try and share the information and make sure it's publicly available.
Thank you. It's the Civil Contingencies Act that I was thinking of, but yes. But that's unique, right? Like having that structure.
Well, I don't think it is. I think many other countries do, but we've used it. And it's been a wonderful piece of legislation. Nobody has fought it. Nobody's complained about it yet, when I last checked. Which for a piece of legislation is pretty remarkable in the UK. There's nearly always somebody complaining.
Other question, Bruce?
Just a comment about this, because also we have a Climate Change Act in Chile in 2008, and basically that meant that there was a lot of assessments to be made, and in fact, we have a review process, the climate change risk assessment happens every 4 years. You know all about it, and then you've got the national adaptation plan that responds to that. So I think it's very well connected from the top to the science academic partners, the users in the broader sense of the word, but it's certainly coming from the top.
So for us, the two big future risks, hardly future, but is antimicrobial resistance and climate change. The two major current risks we're struggling to respond to are things like emerging environmental infections, and the other big huge one is cyber attacks. So we're even testing what we do with the ATM sphere. So the exercise is going on with the Ministry of Finance and others. So there's lots of things happening. We are trying to be slightly ahead of the game. We always seem to be behind the game, but we're trying hard. Thank you, Riz.
Any other questions? Okay. We now are going to run a video presentation from Sujata Salmi, who's in the Indian Postal Service. She's going to talk to how they've addressed forging partnerships in India to scale up equally policy. I think the video runs for about 5 or 6 minutes. So let's do that. I assume you've got sound, have we? Thank you.
Hello everyone, my name is Sujata Sonic. I'm joining remotely from Boston, USA. I'm unable to join in person. I thank the chair and the organizers for giving me this opportunity to share my own work in India, in Maharashtra, specifically around developing the heat action plan. I would like to begin by saying that the human mind is not a desktop computer. It stores very little information, and usually it is something that is flexible, can find solutions, but you have to extract the best possible solution from things around you and people around you. Today, it's I think very important to acknowledge that climate change is one of the biggest issues on the table, and we need to collaboratively find quick solutions to how to deal with the worst of the impacts. It's also very important to acknowledge that we also have access to a whole lot of information than we ever did before. And we are able to find people who can work with us to share their knowledge and skills and help in finding those solutions. I'm sure you would have all heard Donald Rumsfeld, phrase when he had said that there are the known knowns and there are the unknown unknowns, and there are things that we know that we don't know. So using that as a sort of a phrase here to talk about a little bit about the known knowns. It's easier to handle those because you know what they are and how to deal with it. It's the unknown unknowns that always pose a problem. So health managers, practitioners, medical professionals who are on the ground trying to deal with the impacts as they see them, sometimes they don't know because they don't know. So they don't know where to start, how to go about it, what is it that needs to be done. The other very important aspect of today's working environment is that there are so many things that we do together as a team, just like flying a plane. It's not just one person, the pilot who's are faced with situations where you cannot understand what you don't know, you need to reach out to people who know, and then that acts as a catalyst to bring about the change. Often these changes start, I feel, from the state level, not necessarily from the federal level, because in many countries, including in India, there's a lot of autonomy given, especially in social sectors like health and education, to the state governments to figure out, what is their biggest priority and how they are going to deal with it. So in Maharashtra, when we started out, it was the NRDC that came on board. They had already done this exercise in Gujarat with the city administration of Ahmedabad. When they reached out to me, at that time I was the public health secretary, I had pointed out that Nagpur and the region faces huge temperature variation during summer, and they already came with the experience of having done this action plan in Gujarat, and we sort of just adapted and modified it to our scenario. And the enthusiasm with which the people participated, including the neighboring districts around Nagpur, was something which was very heartwarming. Once they came to understand what they should be doing, NRDC's push, the Natural Resource Defense Council's push to bring people on the table and start talking was very, very helpful. I would also like to mention here that it's not easy always to maintain your momentum. Once that outside support tends to sort of step back a little bit, the process slows down because everyone goes back to doing what they know best. And so it's important that continuous support and continuous sort of monitoring lends its weight to the actions that need to be taken. So what in a nutshell, if I was to put it, what are the key ingredients of success? The first is that simplify the complex, break it down into actionable actions that can sort of start off immediately and have a short-term, medium-term, and a long-term action plan. Work in a team, seek out those who know the issue better, and work collaboratively. Hold hands as you go along. Get the experts to act as catalysts to bring their technical knowledge and previous experience to bear on the scenario you are facing. But be flexible and be able to sort of adapt the tools to your requirements. The other thing is be very clear and specific, because unless you are clear about the goal and the timelines, it may be difficult to sort of motivate a big team to continue to work with you. There is a lot of professional risk involved for people who are in the technical agencies who come forward to collaborate with you, because they all report mainly to their own hierarchies, and it's sometimes difficult to find that institutional space and also the funding required for taking such things forward. You have to be very ingenious to find ways and means to keep the ball rolling. And then someone has to see the benefit. So it's important that you engage with the leadership right from the beginning and bring them on board as to what you're doing, because the political leadership also is interested in finding answers, because it's usually the media that highlights these issues in the public domain, and therefore the political leadership is always keen to find solutions. So keep the larger picture in mind. Keep everyone together and talking. Try and sort of assure the technical.
That's it.
Yeah.
It's a shame. It's a shame.
No, just one.
It's been curtailed without no apparent reason. I had difficulty hearing that, but I think there was some pretty rich material in there. Having a clear message, I think, is one of the things that came through very, very clearly. I was very interested to hear how much you said about this political reputational risk associated with that, because sometimes as individuals you have to put yourself forward and be a bit of a champion, take on an ambassadorial role. And depending on the political context, that may not be or may be appreciated. So sometimes we have to personally put ourselves out there. So I think leadership is extremely important. I'm going to ask everybody here, what were some of the clear things that came through for you? I didn't get it all. I've got some.
Yeah, one thing that she mentioned is that whenever you have these programs to kind of external push, so the moment that it gets on, things get back to business as usual. So I think that's a big risk actually. It's the momentum here in many projects. I think that is something that we should actually foresee and then see that whatever suggestion mechanisms that we create, we should actually build into them a kind of an autonomy or people who can take it upon themselves and continue that process. And these actually, particularly for externally funded programs, we should actually see the resource constraints that operate on a regular basis, and we have to constrain our solutions also within the resources that are likely to be available in an indefinite period. So I think that
What were some of the other key messages that came through from that presentation for other people? Anything kind of jump out? Elspeth and Julie.
I guess I was struck by her saying you need to get political leadership on board, which I guess I would have assumed you needed to do, which made me think, are people who are operating in a technical way often forging technical relationships and things are happening that way? So it just made me think about, oh, maybe there's two strategies here, and perhaps they're both useful in different contexts. Yeah.
Julie.
So the thing that jumps out at me, and probably because it's the part that I was most interested in the partnership session, is the role of NRDC in helping get things started. It took, again, a neutral broker, somebody with not a government, not a vested interest, to come in and just sort of seed things. And I'm not sure, I think it was local to begin with, but there was, a U.S. component of that as well. So I was very interested in that piece of it, getting it started. She at the time was in the government, Maharashtra government, and pretty senior, the director of their environmental health group, and a powerhouse, like she, steamroller powerhouse. So she's a great champion. So you had at that point a champion in the government, but even with that, it took somehow that NRDC glue or seed or something to get it rolling and maybe pull the partners together. And that's the piece of the partnership that it's always a bit murky to me. I wish I understood better. But then you're right. I mean, and then she goes and it's, I don't know what's going on in Maharashtra, but because there were external partners, they did, implemented heat action plans in 13 other cities this year or something like that. So the idea did continue, but I think the non-governmental part is part of how it continued, and I guess that's my take. I mean, it takes both, but in this case, the NGO role was pretty significant.
The other messages that came through.
I'm just glad she reminded us of unknown unknowns.
Yeah,
I think that's always good.
Yeah, big surprise. I'm going to backtrack on my plan to breakout groups because I don't think we've got a critical mass for the thing. Should we just continue a bit of an open discussion for 10 or 15 minutes? Apologies, Montero. I know you were more. Oh, sorry. Yeah, okay. So, I wonder, can we go back to the presentation 0? Yeah, so these are some of the questions I was going to use to kickstart or at the seed points for the group discussions. But I'm going to be very rude. We've got a couple of colleagues colleagues from Saudi Arabia with us. Can I put you on the spot and ask you to just briefly talk about what's happening in Saudi Arabia in terms of heat risk? Would you mind or not?
We wouldn't mind, but there is a master class tomorrow, so we're
Oh, you're in that tomorrow. Okay, all right. So
it's just burning that.
I apologize.
Any other questions?
That's fine. Okay. So we have another page with some questions on, but I just wanted to talk to what extent we might think about some of these factors, and I think some of them have come through in the presentation we've just had by video, and Virginia, Julie, and others have been saying about some of the key factors that lie behind development partnerships. And Julia, Ricky, I really like the slides you put up with some of the key factors that determine the development of successful partnerships. I've got to confess, I kind of pulled some of this from the literature. I read a few papers and I thought these are the key things coming through, because people have been doing some research on some of the drivers to successful partnerships, and some of these key factors came through. Can we have the next slide on? And these are some of the other questions. What do you consider as the critical factors for building partnerships for managing heat? Theoretical and practical standpoints. Who should or does collaborate to achieve heat management within an organisation, between organisations, stakeholders, so on and so forth? To what extent might the governance of heat be determined by local to larger scale factors? And Elspeth's kind of touched upon some of those issues. What outcomes might be expected from collaboration for partnership building? It's great to have a marriage, but what's the marriage going to produce? For example, to finance adaptation to heat, you build a partnership, find some money to achieve a particular goal or outcome, implement adaptation to heat, a partnership for research, a partnership for monitoring and evaluation and opportunity. And of course, this question is for people here. Do you know good examples of partnership? We've had some presentations which give us hints at some very good examples of partnerships. I've got a bit of a suggestion for Jim, actually. Perhaps if we can find a couple of case studies which demonstrate very clearly effective partnerships and how those were achieved. Not the diagram that shows the partnerships, there's a link between this organisation and this organisation, but tells us something about I don't like the term, but the journey which those two or three agencies went on to develop that partnership, to deliver on an important goal. What form might partnerships take at the local to regional, national, and possibly global scales? I mean, that's an interesting question, I think, for heat. So one of the goals for the gym is to build partnerships between critical players in this. And so lastly, what can gym catalyse for effective partnerships? Any recommendations for gym? So whether that's a list of appropriate questions or not is maybe debatable. But let's assume they are. Okay, and let's spend maybe 10 minutes just talking our way around those. So, I'd appreciate hearing from you. Yeah. Yes?
Well, I wanted to follow up on the point you made about case studies, demonstration studies.
Oh, yes.
They are critically important to engage and continue to share learning that we've started here. Maybe this goes to what we had talked about yesterday, identifying how the Secretariat of GIN can continue supporting this group to stay together and sharing, learning from each other. So on case studies or demonstration studies, perhaps we can identify a set of criteria that we think could enable, in the end, generation, decision support, capacity building coming together. So on partnerships, which is core to that, we could identify it's not just a journey, how do you get from here to there, but bringing a team together. What did it take to do that? What are the relative roles and responsibilities? And why did it matter in the end that they did come together? What were the disciplinary contributions? And I come from academia now, so it's so hard from an academic point of view to break out of that academic freedom environment to engage with the decision-making community when you don't have resources, not specialized funders that want impactful research. So they need a reason to want to engage with a multilateral or any decision-making body to make science useful. So if you can, through studies or projects or demonstrations, if we can show why it mattered that a geographer and urban planner mattered as part of that team's product to make an impact, that could be significantly helpful, not just to the research community, but to the policy-making community to reach out in the first place to technical communities to work together. So I think in the end, we're all talking about doing science really differently, in a way that we design research questions that are policy-driven, that are not just nice to know, but I mean, just absolutely necessary to know now. So
breaking away from just curiosity-driven questions to
that's
pulse.
That's good. I'm not
Policy
discounting that. But I think we live in a time where we need evidence-based decisions.
Yeah, so going back to Jin and your comments, perhaps we could contemplate a set of criteria for identifying 2 or 3 gold standard case studies, which really would be kind of an effective tool for other people to learn from. Yeah.
So I think coming back to your point, because throughout these 2 days so far, there are certain topics about heat protective measures or activities that communities or personal people have done. So cooling centers is one of them. Drinking like water is one. So another would be let's say going to cooler, like shaded areas. It would be great to get one of those really practical stuff like cooling centers. And so you have the people who come up with the research for why cooling centers are good for health. But then, because it's a very practical and logistic thing to look at, so you also want to invite the people who open those cooling centers, the decision makers who say, okay, we are now paying funding for that, but also a lot of on-the-ground stuff. So people who are running the cooling centers for 9 days or like 12 days, what stuff do they need, and what other barriers are people going in or not going to cooling centers? So I think it's beyond kind of knowledge. It's also just people who do the decision making, and also just everyone who's involved. So it's also people who use them as well. So.
Yeah, I think the most critical factor in building and sustaining partnerships is actually to create mandates within the governance structures, mainly involving the net service as the primary source of information, so that is typically the official authentic source, and also providing a documented set of actions. It's almost like action plan that we have, but this should be part of the routine management, and they should be accountable if they don't follow certain procedures. That's one thing. And heat wave is a recurring phenomenon, so you need a mechanism actually which helps all these partners to come together and have a forum like this on a regular basis. So in WMO we are clear, we are promoting this what's known as National Climate Outlook or National Climate Forum. This can be done even on subnational scales. So these fora seasonal context or the heat wave context can create interest to bring not only the med service and the health service, but also to bring other related ministries and agencies like water, food, because these are all compounding factors in the heat wave impact. So that type of forums which can be convened immediately preceding or like preceding the heat season can actually kickstart the process, what to do and how to proceed in managing the heat wave. So in terms of you need mandates and you need a mechanism to actually sustain that process.
Just to add to that, it could be something like a solutions package, for example, and you already have amazing convening partners, WHO and WMO deciding to work together. There are other inter-UN groupings now. This idea of one UN as an amazing convening partner, power, sort of bring people together. And then you have regulatory drivers like the ones that Virginia mentioned. You also have SDGs that we all have to map to. So for an event like a high-level political forum on the SDGs, which happens every summer, the Secretariat of GIN could help organize us. This is part of how do we stay together, sharing, working together. And each year, as you know, for the high-level political forum, there's a cluster of SDGs that is focused cluster. This coming year will be climate and education. So we can organize a solutions package or actions targeted to those themes, linking to health and SDG 3 and health and well-being. That could be pretty powerful. Using that as a leader to some of these global and local environmental changes. So that's, the Secretariat has organizing hope to kind of keep us together and then sort of look out to these kinds of high-level events.
So, I mean,
Secretariat, by the way, is like a volunteer organization. I'm willing at the moment, but we're getting there. No, with a Kumar and then
So I mean, based on that, you see GIN having kind of a lobbying role. We lobby for the cause. We become political lobbyists.
Well,
Julie?
some of you can.
Because we're unshackled, we're free.
Right. Well, that gets to the nature of the roles and responsibilities of the partnership, which I wanted to just like applaud or echo Julie's comment here in one of her list. One of them was clear roles and responsibilities, and I think that's really important because we can be part of the same network, and you guys can never go talk to our congressman, and everybody knows that, but you can't go, So, but I also think that your point about the SDGs and the visibility. I mean, Virginia is going to put them in the spot here in a second, so heads up. But the SDG platform, we were already thinking of the, part of the timing for this conference was the recommendations from that, from what we come up with here, can maybe feed into the Sendai platform. It's not the SDG one, but so we're already thinking about trying to, feed in some way. I'm not sure what we should be feeding into that one, but this makes a lot of sense. I think as a network, we can look for a few high-level kinds of visibility. Things can't do everything. So that wasn't my original comment, but I liked that idea. So that seemed to make sense. And from a UN perspective, I think it would help us find some of the right partners. But I also really liked your list of tips. I don't know, it was just like it's straightforward and all. So I feel like we as a group, could kind of adopt, co-opt your list, make our adapt it a little bit, and sort of like here's the basis of what a partnership for GIN should look like. I would add one piece which we haven't talked a lot about, but that it's also that defining demand part, that we're making sure we're solving the problems that need to be solved, not just building partnerships for its own sake, but really using it to drive the questions, which gets to that your point about being really answering your questions. So
I think that's how you evolve too. It's not just a fun time when you play or you do.
Exactly, it's an iterative process, and I think I'd like to make sure that when we leave, this breakout, we're thinking about all the way from top to bottom the partnerships, from what's driving the question to how do we sustain it and how do we, get the different levels. I live in the world where the mandate issue is supreme, right, every day. So I don't know how to fix that. If I did, I would have done it a long time ago. But some of those issues, I think it's worth saying. Having a clear mandate, but not just having a clear mandate, but talking about maybe as a part of this report some of the entities that need to work together differently, and just being clear about that, because it's not. Kumar and I were talking. Kumar's like, well, we have to help people leave, and that's not going to happen. The Met people aren't going to lead either, and nobody's leading. That's why we're in this circle. So somehow we have to get beyond ourselves and say, all right, these 4 entities are going to lead, or NRDC is going to lead. Somebody has to step out with a team of people, or the team has to agree to step out. So I'm not sure which way that's going to work, but we're all here with different capacities. So after we leave, somebody's going to have to step out in some form to do something, whether it's a consortium of 3 or 4 institutions that decide to do it, but with the responsibility, so we can go back and say, yeah, we're not stepping on the health toes, they want us here, and the health people can go back and say, oh yeah, we're not stepping on that toes, they want us here, and Julie can say, we're here to straighten these people out because they're a mess. So I think that having some recommendations about the types of partnerships, and maybe explicitly that, moving forward, Jim needs to, develop a few strategic ones and map out what those roles and responsibilities actually are, so that we're not going to fix the mandate one right away, but we can do something to kind of get a step in that direction. And then we still do the SDGs. That's a good idea.
So it strikes me that the Jim agenda is beyond the boundaries of the nation state, because we tend to organise most of our thinking around the nation state, a particular country, and a hazard like heat has no respect for political boundaries. It cuts across countries. So 5 or 6 countries experiencing an extreme heat. So I'll invite you for the next 2 or 3 minutes to think about your region, which you live, and think of the countries that surround you, and the agencies that might form an effective partnership as a regional response to managing the issues that arise from extreme heat. Yeah. Awesome.
I had a comment on that anyway. So
Oh, okay.
Sorry.
Oh, good.
Just go ahead.
Yeah, we haven't been rehearsing this, have we?
No.
Good.
And it's also a response to the various comments, actually. So one of the things that I think would be really important, and not to sound negative, would be that in thinking about what kind of partnerships make sense, we're also letting that be led by the phenomenon of heat itself. Because there's an awful amount of advice that is good. That we let our decisions about what partnerships are useful be led not by our sort of habitual relationships or our habitual models for how governance is structured in transformation space or UN agencies or regional organizations, but we let heat itself drive how we understand what partnerships need to happen, because what we see is a lot of advice that is good in one context being applied elsewhere and being bad, negative, disruptive in those other contexts. So hydration, for example, hugely problematic in human regions as the main message that we push. We end up people in hospital for hyperhydration. We've got models that are great in one part of the country, bad in the other part of the country. And so I think that we really need to think about the precision of what heat is. Is it chronic? Is it acute? Is it a humid heat wave? Is it a dry heat wave? And let that drive how we're structuring the relationships that we're seeking to form. So there's no point in us in Australia doing stuff together. I'd be more interested in Northern Australia about tropical coordination, and I think that would be really important. And yes, there are existing partnerships and collaborations that we can tap into, so it would make more sense for us to talk to ASEAN than it would for the Australian example is a good one, but if I was in Africa, it wouldn't make sense to use the WHO African region because they have such a variety of climates. So sometimes those things are useful and sometimes they're problematic, and we need to think critically about those things.
That's interesting, because I've often thought, sitting in my academic office, because you're paid to waste time and think. And I've often thought of the concept of climate health regions as opposed to political regions. It's the idea that climate or other resources cut across political boundaries. So your comment about Northern Australia being different to the rest of Australia is very correct.
Can I ask a question of this group? Because Hunter and I had this conversation for a while, and Joy and I too. When we first started this, before even really Jen came to be, we were thinking that it would be useful to have a map. So it started with my other service and climate service hat on, but the maps that map different zones, tropical, mid-latitudes, whatever. And then
I've got that map.
Yes.
I produced it.
Okay, well, so then perfect. And then to do something that says, all right, then mid-latitude, temperate climates with this density of population, these are the best parameters under these. So we begin to get advice. So I was driven by, okay, with the Met Service doesn't even have capacity to do a heat forecast. What are they going to do, or what could somebody else give them or help them do? Do you think that we could do? Do you think it'd be useful? And if so, do you think we could tackle that? Oh my gosh, it scares me. But as a GIN network, because I think within our community, we probably have the capacity to answer some of those questions. And just because I had the idea a few years ago, it keeps percolating. It keeps coming up in different ways. So you're.
I think that would be gold.
Do you? I don't know that we could. I mean.
Well, I think the research community would leap upon that straight away. It's a great shot.
Yeah.
And it certainly resonates with some of my thinking over the last 10 to 15 years.
Well, it probably came up in your office when we were sitting there brainstorming that day or something. So, yeah. Okay. That would be it.
Sorry. For being neglected. Virginia then.
Only mine.
Your ideas of partnership working came through very strongly when you and I met at the Urban Health and Wellbeing Board. And I think that was quite incredible when we were working together on that. We've been working very hard, Julie. I love your list of what you described here. Not you, Julie.
I know, it's a list.
You published a paper on the value of networks. And we were very surprised how few evidence resources there were out there except in the business domain. Business domain gets networks, we don't. So we had 6 criteria from a paper we recently published, which I just wanted to see if it reflects, Monteiro, the thoughts you had when we were in Lisbon together, of coordination, resources, learning and knowledge, facilitation, diversity, dynamic and adaptable. I think that we need those 6 leadership domains that we should be working in with clear benefits and challenges that need to be identified. And this might be a very useful paper for Jim that we published last year. I like the fact that we are looking at a partnership that will work, and I know Monteiro needs to comment on this if I can suggest it then, because her experience is enormous. So I'm giving you a bit of time to think about it. Sorry. Really to try and make sure that if we are to have Jim, we know how and what we're trying to achieve together, rather than this vague dream that we can improve the weather forecasts, the information, the resources, and how we partner. I think we need to have a clearer drive than that, a vision, which I think is there now, and how we do it. But I'm also concerned that we do need a clear secretariat, we do need resources to hold it together. But I do think we should look towards things like how we deliver Sendai, how we deliver the SDGs, how we go to the UN high-level political agenda, and how we try and deliver definitions. To me, in the world that I sit in with UN member states, there are quite a lot of things that are needed by them, and I think we should look to what they need, because they are our users, and I'm not certain that I've very heard many voices from our users so far in these 2 days, and I think that will be quite important. But Monteiro, would you like to just add a bit more, because your knowledge, I thought, came shining out of the work you have done. Would you comment a bit more on some of those thoughts?
Spotlight's on you.
On the user, identifying user needs, UN has done a fabulous job doing this, but that's where we need to take advantage of these assemblies. Come up every year, schedule. That's again another secretariat role could be helping us just coordinate if we're going the messaging and what we can offer. And those are opportunities, very concrete opportunities for shaping a conversation with member states at ministerial level. What do you need? What specific evidence base do you need to help you do your work better? You can organize all kinds of satellite events around the main assembly to very much target those kinds of questions to very specific audience. So that's where I think we should be taking advantage of identifying a set of needs which will evolve over time. When we had an opportunity to have some sessions, or organize some sessions at the UN Environment Assembly second one, 2016, we took that as an opportunity to raise awareness among member states of the environment and health mixes that way. And unknown to us afterwards, there came a huge demand, not as a result of what we did necessarily, from member states because of their recognition that environment and health are worth addressing together. So they went to their UN UNEP agency to almost demand from this recognition. We recognize this. What do we do about it? How do we make the case for member governments to work across sectors? We have a financing problem. We don't want to divide the budget pie any more than it already is. What can we do? What's the information? What is the co-financing? What are the cost measures you have? What are the solutions? What are the costing of those solutions to take this kind of co-benefits-based approach? So that came out very clearly from member countries, and ever since then, it's only 2 years ago, the UN itself has reorganized somewhat. WHO working together, WHO, UNEP is working together, WOGP and WHO now working together. There's a lot more of the cross-UN collaboration, and it's now trickled down from the global level down to the regions. Now I'm sitting in the regional office where they now have to respond to what's happening globally, and they have to do it in a way that shows results and impacts. For me, at the regional level, and it means translating that available evidence into implementation activities to make progress on the SDGs, to make progress on SEDI. So those mandates are incredibly important because they have to show progress. And it's also a very competitive region. You see competitions around the world to share results, share progress, and then to one up each other. And that can be a good thing, and that's where I think the innovation and partnerships can really come out in a good way in terms of solutions and improving on solutions over time as conditions change. So my recommendation is to take advantage of these assemblies, very high level fora where ministers come together, environment and health ministers come together. And a number of these are scheduled way in advance, know about them ahead of time, plan for them, and then make sure that we're coordinating in our messaging and what we can and are prepared to offer. So I guess one question I have for this group is what are we prepared to do as a technical partner to communities and countries and cities to support evidence decision making and capacity building? Are we prepared to give technical assistance? For how long? Prepared to give trainings? How many? At what level? I think that's one thing that local communities don't often drill down and really think about, okay, what is the investment required? We know we can offer advice and expertise, but it's going to take a lot more than that for a country or a city to take up and to do evidence-based decision making on its own. What are the steps involved in jumpstarting that process? How analytical are we prepared to play in that?
I've got a question. It's kind of an aspirational thing. Maybe Julie can help out with this because you've just come from COP24. Do we ever imagine ourselves being at COP25? And could we go? And yeah.
We can certainly have a side event though. We could ask for it. Particularly when it comes to London in 26.
Oh, right.
I think it's coming to London COP26. So we can certainly ask for it.
What are the other most important, if you were going to say, what are the other assemblies, a subset that you think would be really important? The Central Global Platform and World Orbit Forum, okay.
So one of the things we do know, Julie, is that WMO is organising an early morning 2-day pre-meet for the global platform. And I think we should have a gym meeting there. Can we organise that through your help, Kumar?
Yeah, I can do.
So to me, immediately we're getting WMO saying that the Global Heat Health Information Network, just as Montero suggests, is part of the delivery of the Sunlight Framework. And I think that will help to show that it's a heat health information network for something that we haven't even defined properly. I think this issue of definition really frightens me for the UN member states. We will not get traction unless we've got a definition. We cannot get that without it.
That's interesting.
Early warning systems.
I would say, for example, in the urban side of things, each nation has its own definition of what a city is. There is no global definition for either. So it's not impossible.
No, it's not impossible, I agree, but it's easier if you have one. Because
Yeah,
then we start
easier, but not
documenting these events. And as you say so clearly, Julie, it's transboundary. For a lot of these heat waves we've had this year, they have been transboundary events, which is really frightening.
So you said earlier about so looking at not country by country but by climate, so subtropical blah blah. Somewhat proposed, I'm not sure if it's possible, instead of having case studies on individual interventions or whatever, but have one case study for subtropical climate, one case study for a moderate climate. This way you can see across which different cities and areas and find those clinical thresholds which a lot of different cities have in terms of for respiratory, for diabetes, for CBD. There's a lot of RRs and ORs. We can consolidate those case studies by climate. This would be a new way that has a very set definition already, so we can have at least one clear definition by climate, and then we can
Folk, how are we feeling about time? It's 5:30. Are we about to run out of steam, or do you want to keep going for another 5 minutes?
Let's just wrap up for 5 minutes and see what we can
Yeah,
come up
okay.
with.
Well, let's wrap up in 5 minutes. Any other? You've been very quiet. You might be saving all your strength for tomorrow, but is there any contributions you'd like to make now?
No, actually, one of the things that I was interested in terms of the case studies that we were talking about, in terms of partnership, definitely. I know there has been a lot of different partners and different disciplines and different levels. What would be interested is to highlight, you mentioned the journey of a case study of a journey, or let's call it a success story of partnerships. So I would look for a highlight personally of how did we achieve that on what level. You know, there are stakeholders, there are technical teams. So if we highlight this pathway, it would make it closer for other people to, let's
let's say, implement on other levels or in other regions. So this is very interesting. I like this the Red Cross partnership success story, honestly, we call it. So if we can highlight it as a pathway, that would be very, very interesting for us to see and be documented. So this is what has been done, at which point or at which level it started, and how it started to reach the different levels and different sectors of this partnership.
So it's almost like writing your life story, you know.
Let's call it that. Let's call it that. Yeah, it's worth documenting, honestly. Yeah. I know a lot of people would benefit from such great stories.
I think the idea of writing the story about the partnerships is a good point I'm taking as case studies in addition to your other. So there's, yeah.
Maybe we can commission J.K. Rowling.
Okay. Would you like to do that? Didn't we?
Yeah, sure. Yeah. I'll get her on Twitter
go to the
tonight.
mansion there, but
Write us a story, not too much fantasy. Okay, well that's yeah. Before I start fantasizing about things in general, perhaps we should draw things to a close. But there's been a lot of good stuff, I think, this afternoon. We had some excellent presentations, talks about something which I think is at the heart of the success of managing a problem, having essentially the right people in the room, understanding common goal, what we're trying to achieve. And I think emerging from these discussions, we're getting a sense of what we want to achieve, and I think we're getting a sense of where we'd like to achieve it politically, and that's extremely important. I'd just like to thank you all for your positive contributions today. It's been fantastic. Today we've had 2 days of gin. So far it's been very good tonic. Yeah, I've been waiting to get that. It's all about timing, I was told. You know. So look, thank you for today. Have a very good evening, and we'll see you again tomorrow.
Yes.
Okay.
If anybody wants to stay
Yeah. Oh yes. Feel free to come and play with Virginia's toys.
So, ciao. I didn't know where we could. I invited you, so I didn't know where else. Whether